Oh, okay. Good afternoon, everybody, and welcome to the Performance Management Scrutiny Committee. I'm obliged to inform you that this meeting is being live streamed and recorded. Please note we're using new microphones today, and it is the right-hand switch to turn them on. They are quite sensitive, so don't get them too close. Please use the left-hand button to switch off. So I think that's the housekeeping. If there is a fire alarm, it won't be. It will be the real thing. It won't be a trial. So I'm going to go around the table and introduce everybody. We have a lot of other officers in the room who will probably speak at various times during the presentation. So when they speak, if they could just, I think there's some microphones there, they could just introduce themselves. That would probably be the most helpful way to do it. So my name's Claire Wild. I'm the councillor for the Severn Valley and chair of this committee. To my left.
Hello, I'm Sonia Miller. I'm the Assistant Director for Children's Social Care and Safeguarding.
That's when we're not Western Task.
Afternoon all, I'm Tony Miles. I'm the Director of Children's Services and Exec Director of Youth. Hello, I'm Ruth Houghton, Councillor of Bishop's Castle, substituting for David Vassman.
Councillor Steve Chapman, Whittington Division.
Councillor Paddy Mullet, Whitchurch North.
Roger Evans, Councillor for the London Division.
Councillor Joyce Barrow, St Oswald Division.
Councillor on AC Development Slash in the Western Division.
Councillor Julia.
Right.
Councillor Julia, the second councillor for Bridge North Western Task.
Ted Clark, excuse me, Ted Clark, based in Oak Commons, Sutton, 3-member ward, specifically and determinedly responsible for this. I'm substituting for Councillor Alan Mosley, who's unable to attend today.
Okay, thank you. So we have apologies from Alan Mosley. So Mr. Clark is substituting, and we have apologies from Vassman. So Ruth is substituting. Ruth Houghton is substituting for him. Item number 2. Does anybody have any disclosable pecuniary interests that they'd like to share with us at this time? No. Okay, item number 3, the minutes from the 4th of May and the 12th of May, which was circulated this morning. I'll move those from the chair. Do I have a second? Please, thank you. Is everyone content with the minutes?
Chance to read.
Okay. Should we have a show of hands? Just so that, okay, thank you. That's carried. Item number 4, public questions. There are none. Item number 5, member questions. There are none. So we're moving on to item 6, which is children's social care and safeguarding performance. So Tanya and Sonia are going to be doing a bit of a double act. Sonia has a presentation. This was brought to performance management at the initial suggestion of Councillor Alan Mosley. I don't know if he's able to join us remotely, but it was at his suggestion, and I agree it was a very good idea. So that's how come this is here today. So without further ado, who wants to go first? Do you want to go first, Tanya, and then?
Thank you very much. So we welcome the opportunity to come to today's scrutiny and to discuss children that are in the care of the local authority. Members will remember that in the last cabinet session we presented a report on our performance, and rightly so we agreed to bring forward to today's scrutiny committee 4 areas for us to consider as scrutiny. We prepared for you in advance a summary report that Sonia, our AD, will set through now, some slide decks, and then we'll open for questions if that's okay, members.
That's fine, thank you. Right, pass you over. So when you're doing the slides, do you want the question while you're doing the slides, or do you want to do the slide and then have the questions?
It's entirely up to you.
Okay.
I don't think it makes any difference for us. There's quite a natural break between because the service managers are going to present it, so it may be that we do questions.
Oh, that's good. So it
There's
says
a natural
match.
break.
Okay.
It's into the sections because they're going to present it.
Okay, thank you.
Okay, good afternoon, everybody. Thank you very much for this opportunity for Children's Social Care to be here today in front of Performance Scrutiny. It's the first time we brought, as a department, any of our performance data to Performance Management Scrutiny. So we really value the opportunity. As Claire has said, we were at Cabinet very recently with our Q4 performance report, and out of that came some questions around 4 specific areas. So today we're going to be presented, and it's in the report in quite a lot of detail, information in relation to assessments and the timeliness of completion. They are statutory assessments. Children on a child protection plan for longer than 2 years. The increase in numbers of looked after children, and why do we think that's happening? And care leavers who are in or not in education, employment and training. So those are the 4 specific areas that we focused on. There is some additional information in the PowerPoint that's not in the main report today, but that was to expand on some points that we thought may become questions from today. I do have the service manager leadership team with me here today. The whole team is here. They know the detail of this information. So what we're going to do is, as we step through this, is they'll present the area that is relevant to their service area. So if you then have got questions, they can take those questions while we're kind of moving forward, if that's okay. So if we could just move on to the next slide, Daniel, please. Thank you. As you know, in February 2022, we were inspected by Ofsted. For those of you that don't know, that is a 2-week inspection with 6 inspectors, and I would say it was rigorous, as would be an understatement. So a lot of what I share with you today is based on information that's been tested and inspected, so we're not kind of just making it up as we go along. The most recent report was published in March, and it concluded that we as a leadership team, and that includes yourselves as members of the council, as well as cabinet, as well as us as senior leaders and officers, that we know ourselves well, we make good use of data and management information, and learning from quality assurance to inform service planning and developments within the local authority and across our partnerships. One of the aspects you'll hear at the beginning today is Siobhan Hughes, who's my service manager for quality assurance, stepping you through a summary of our quality assurance framework, because that's how we evidence what we're sharing with you today. Siobhan, do you want to take that forward?
Hi there. So as prepared, Ofsted have came to, can you hear me, sorry?
Yeah.
Yes, I can. Can you put the slide up on the screen?
Sorry, Dan, can you move it forward one more? And the next one.
Next one.
Apologies for my very Scottish accent. But so Ofsted have visited us in 2017 and February 2022. And each time, and visits in between, they have told us that we have a robust quality assurance framework. Our quality assurance framework includes performance information, and we have a large amount of performance information. And we've made sure that that's accessible at every level within children's services, so workers and managers and senior leaders have access to performance data which is appropriate and is understood by them. That performance data is regularly scrutinised, and it helps to identify areas of the service that we feel need support or are working well. We also have a programme of auditing that takes place every month, and those audits we use a consistent template, and we look at the children's journey and children's social care, identifying areas of strength in individual children's practice, areas that we need to work on, and actions, and we closely report on those actions on a regular basis. We also do regular dip sampling as part of our quality assurance framework, so our performance information speaking to our workers and service user feedback and our child journey audits, we'll identify areas that we want to look at in greater depth, and we will do regular dip sampling with the other managers together to help us to understand specific areas and themes in practice. And we also utilise group auditing to make sure that our auditing is consistent and that we've got a good understanding, and our managers have got a good understanding of what we are looking for. A recent example that we could give you is that we have audited the last 50 children who have been accommodated by the local authority to help us to understand if that was appropriate, that our thresholds are appropriate. And for all those children that was appropriate, but also it helps us to put a lens into why children are becoming looked after. And that learning that comes from each of those audits then creates a set of actions that we then implement into children's social care. And we measure the impact of those actions for children, and that's how we know that we're being successful in implementing those actions. We also produce a quarterly quality assurance report that includes all audit activity and every child who's been reviewed and looked at within the service. And quarterly that amounts to quite a lot of children actually. So we know that we've got a good lens and a good understanding of practice within the service.
Can I stop you there?
Yeah.
Give you a breather. Would you like a glass of water first? Or
Yes, I don't know. I'm just beginning.
I'll get somebody to sort you out for me.
Thank you.
So have you got a copy of the audit? Just so that obviously you can't tell us anybody's name, but could you, the steps you go through in the audit, or what's on the blank audit piece of paper? Have you got one you could put up on the screen or not?
Probably if you give us 5 minutes, we could probably do that.
Okay, so that would be really helpful if you could do that.
Yes. Yeah. Do you want me to send that to you just now, Sonia?
Yeah, please.
When you finished, Siobhan.
Yeah, you sorted out with Sonia.
Yeah. And I think it's just in terms of the quarterly report that's done in that analysis, it brings all of our activity together and it creates a set of actions. It also helps us to understand how we have closed the loop on previous quarterly actions as well and the impact for children. And we sometimes we make sure that the learning is shared in different ways. In breaking down that quarterly report into an easy to understand format for all workers across the service, and also ensuring that we have learning briefs if that's required to really look at a specific piece of practice. And what also is involved in that is when we have a child where we think that there could be some learning on practice, we will do what's called a learning circle, and we'll bring practitioners together to discuss what we could have done differently and then share the learning from that as well. So I think that's a synopsis of it. Certainly I'm happy to answer any questions.
So we I don't know if you know about the Shropshire Plant.
Yes.
Okay, so the Shropshire Plan basically is our plan as to how we're going to move forward. So a really important part of the Shropshire Plan, and the bit that I'm working on, is the performance indicators. So there'll be lots of different performance indicators, some officers like, some the public like, some the members like. The members are particularly interested in this particular area. So I don't know if anybody's contacted you to see if some of this performance data can actually be turned into performance indicators.
Yes, we have it.
I'm working on it.
You're working on it, okay.
Yeah.
Okay.
And we've also got a lead within the performance team as well for children's. So
Okay.
So the answer to that is yes. So we're working with Tom Dodds to determine which of the performance indicators we need. We've got a wide range that are statutory KPIs that we have to report on nationally. There's a huge number of those, and then there's a lot of other data that we collect as well. So we're working out which ones are the most appropriate for the outcomes that are identified in the Shropshire Plan.
Okay, so the other bit is, sorry, I'm picking on you because you came first. So the CCG is no more. So we have the integrated care service. So I mean, I think moving forward, that relationship is going to be key to all the things that we want to achieve. So it's early days yet, but have you found a way to link in with all these people or
absolutely.
with the service?
So I'm going to be co-chairing the quality assurance subgroup for the ICS.
Right, okay.
That's a representative from the ICS.
So there will be, because I think part of it is, an important part of it is for me, is that we are able to share data.
Yes.
Because I think some of our downfalls that will come up in the report are due to data not being shared across the partner agencies.
Yes, I mean, we have recognised, we also work very closely with the safeguarding partnership as well, so I have been really focused on trying to get that, influence that data as well, and ensuring we're learning from each other really in terms of data. I think that's why I volunteered to chair the subgroup of the ICS, the volunteer chair the subgroup, to share our learning in terms of how we approach data with them.
Okay, thank you very much indeed. Right, yeah, Tanya and then Roger.
Just come in there. So just as an example, the last 50 children that came into our care, 25 were under 5, which we've taken forward with our health partners for them, because they're the ones that have the eyes on the child, the children under 5. So we've gone back to our health leaders to put that challenge back to them in terms of how can we early identify these children under 5. And we've held our first face-to-face workshop with over 150 health and social care practitioners a couple of weeks ago, where we held the workshops to remind us all about the early signs of neglect and the importance of sharing information across the partnership. But it's just an example of how we use that really important audit to drive forward and change.
And we apparently Daniel has got that audit sheet to put up. So if you put that up and Roger, you can ask him a question. You're right, Daniel. You there?
Yep, I'm on it.
Okay.
Bear with me a moment.
Yeah, hey, Roger.
Thank you, Chairman. In the report before us, I note the paragraph which says that the child protections continue to be low 222.
Can we get to that, Roger? Sorry.
Oh, it's data and quality assurance.
What is it? Sorry, I apologise.
Yeah,
because I think that's gonna be a
in that section, which is why I brought it up now.
Sorry,
I know it's referred to later on. Okay, but pick it up later. Saw on the report where it said social worker would be invited whenever possible. Is it abnormal for a social worker not to be present? On the previous slide that was there, it said the social worker would be invited to be present when it's looked at.
For the child journey audit.
Yeah.
Yeah.
And wherever possible, they would be there. So would it be not? I used to, many years ago, members used to be involved in the audit for this, and it was noticeable then, going back prehistoric times, if you wish, members sat on that, and it was sometimes noticeable that the social workers were not present, but it would be abnormal now for them not to be there.
Sure, do you want to take that?
Yes, I mean, our aim is that the social worker is always involved in the audit. Sometimes maybe the social workers not at work, or they may be involved in particular for a particularly long court case that was related to within the time scales. But certainly the social worker would then be sent a copy of the audit and they would be informed. So our aim is always to involve the social worker, and when they're not involved, that's the exception.
Okay, you're clear on that?
Yeah, and also would the parents be present at these meetings or not?
Yes, we do. We do include a service user feedback section in the audit tool at the end. So the auditor is required to then phone the parent to get feedback as part of the audit. That's an essential part for us, really, of that quality assurance framework, is including the views of parents.
Okay, Ruth, you want to ask a question?
Thank you, Chair. Under it sort of overlaps slightly with the overdue assessment, but from an audit perspective, is there any additional auditing or review of the activity data on those overdue assessments when they're completed? And as a result, are interventions higher than perhaps they may have been because the assessment's overdue? Is that data collected, or is it work in progress?
Okay, so I think Jeanette needs to take that question when we get to Jeanette in the assessment section, Ruth, if that's helpful. Jeanette, can you address that when you do your?
Okay, So, Sonia, do you just want to talk through?
Siobhan, do you want to talk us through that?
Okay, sorry.
Yes, yes. So we revised this as our child journey audit tool, and we revised this on an annual basis to see if it's still appropriate, and it's what we need to look at in terms of base practice. We have 5 practice priorities in children's social care, and we have those practice priorities so that we can focus practice improvement and that we can measure our progress on a quarterly basis against those practice priorities. And you'll see that the child journey audit tool is set out on that. This is one for children who are looked after. They have a separate audit tool for children who are on a child protection plan or who are on a child in need plan. So the first priority that we look at is in seeing and hearing the child, and you'll see that that audit tool sets out the areas that are to be looked at. So we expect every box that is relevant to be filled out on the side, and there's some guidance there on the left about the judgment. So we want to make sure that children are seen regularly and in line with what their plan sets out, and that they're also seen alone as well. And we'll see some focus there on direct work. We want to make sure that visits to children are purposeful and that we are doing work with children on those visits as well. To move down.
Move down, Daniel.
So assessments, then you can see that we've got a section on assessments, so that's one of our practice priorities. And we have we really want to make sure that assessments are timely. So we do regular assessments. In fact, we do more assessments in Shropshire than is done for some children and other local authorities, because we're able to benchmark that. And we make sure that that assessment is analytical, that it includes the views of parents, includes the views of children, that we are utilising evidence-based practice and theory and research where appropriate, and we're really identifying those protective factors and risks within those assessments. And if you go down to just the bottom there, then although we ask people to fill out every sort of section at the side, there is a summary box at the bottom where we ask people to give an individual grade to that area of work. So that would be inadequate, requires improvement, good, or outstanding. The plans and planning section is about making sure that children have an up-to-date plan that is really reflective of the assessment, what's been identified within that assessment, and that it's a multi-agency plan, and that all agencies have got actions within that plan. Previously, it used to be a lot of actions for the social worker, but we're really keen to involve all the agencies that we work with. And also that there are actions within that plan that are important to the child, and that people can understand that plan. And what we use is a SMART template, and that SMART template is about making sure it's achievable, and the actions are done timely, and making sure that who is responsible for each action is clearly identified. Could you just move down? Just down a bit further, actually, just on to the next section. Okay, so we've got supervision and management oversight. So supervision is an essential bit of social work practice, and it's actually an intervention in itself. And we need to make sure that that each child is subject or discussed in regularly in supervision, and that the supervision happens between the worker and the manager, or the manager and the manager. And there's management oversight quite clearly recorded on each child's case file. And we expect that supervision not only to be timely, but to be reflective and to have clear action for the social worker within that. Just go down again. And so this is meetings and reviews. So depending on which type of plan the child is, they'll have a different type of meeting. But we do that regularly, because children don't need to just have a plan and an assessment, but we need to have regular oversight of that plan and make sure that it is progressing. So we expect that plan to be discussed by the multi-agency group that are working around that child on a regular basis. And we expect children's views and parents' views to be included within that meeting and review. And where its professionals are not able to attend, we expect them to give an update and a report. But to be honest, we do have good attendees from our target agencies in Shropshire. If you go down, yeah. You'll see the service user feedback section that we alluded to earlier on, and that's where we contact parents. And these questions that we have in here are based on a piece of national good practice that we identified a few years ago, worked out to be good questions for giving that type of feedback. And the questions there around, thank you, around my social worker being on time. You know, that one was included because that was something that was really important to parents and children, was that when a worker was coming in to see them, that they came at the time that they said that they were going to come up. So we collate all that data, and that is included separately in a separate section of the quarterly quality assurance report. If we go down again, so you can see the social workers' comments there. So we like the social workers' comments to be included within the audit, and you know, we might disagree with it, but if you're doing it with the social worker, then you're doing it together, and it's there. So the key learning from the audit is collated into that section, and there is an overall evaluative summary of the judgment, and that helps us to give us a benchmark on where our practice is at. And we look at that not only on a quarterly basis, but we also do an annual report as well to identify key themes from auditing and look at the progress in our practice. And as you can see there, you've got the actions at the bottom, and it's very clear that who the audits need to be returned to, and it's got to be reported on our case files as well. So if anybody's got any questions about that.
Raise thoughts or something.
Thank you. Thank you, Chair. Just on the audit tool, how many audited cases are escalated to the service manager as per that bottom box? And then how do you close the loop to check that they're actually happening and discussed again in worker supervision?
Okay, so we it's not often that we escalate to a case to the service manager or down to the service manager. We will it's not going to be when there's an inadequate audit, but we keep in regular contact, you know, with especially with the case management service manager, who has a complete overview of how many children are graded requires improvement, inadequate, good, and outstanding. I couldn't give you a number off the top of my head on how many are escalated to service manager each month, but it would definitely be less than 5.
So I'm not sure if this is the right place or not, so tell me if it's wrong. But so I think the important thing for me anyway is to actually track our children through the system. So this is great, but I think there's some work needed to actually come up with a system, and this will be probably work to do with the ICS, to actually map out a path and track them from start to finish and see how that journey goes, because I think that's where we're going to get most of the information from.
So that is something that we do, Claire.
Yeah.
And I think that Siobhan will address that a little bit in her aspect in terms of how we track cohorts and such.
Right, okay.
I think the point that we will need to pick up, as you identify, is how do we link that in with the ICS?
Yeah.
So I think if we let Siobhan cover of how we track cohorts of children and follow them through in her aspect, when should we get to looked after children numbers? Is that okay?
Yeah, that's great. Thank you.
Shall I take Roger's question?
Oh, sorry, Roger. Yeah.
So, Roger, you asked a quick question around the paragraph in the report under section 3 that despite the assurance on threshold, numbers of children subject to child protection has continued to be low, and then the children looked after has increased. So we are actually seeing a shift in that. We're seeing a slight increase over the last few months in child protection, coming back onto child protection plans. But I guess the point we're trying to make there is that we've audited that threshold, and children aren't coming in at the threshold of child protection, they're coming in at the point of the harm is so significant that we have no alternative but to take them out of their families. And that's why we've seen the increase in looked after children. And what we want is to see that rebalanced. And what Siobhan goes on to explore a little bit is why that's happened.
If I can, Chairman, subsequent to that, and it may come up later, and that is second protection orders, which is very disruptive. I know it's referred to later on, but is it best to ask that now or later? Because how many second orders are there because of the disruptive on the child as well as the family, etc. And
Child protection plans.
yes,
Yeah.
this is child protection plan is what I'm talking about.
Siobhan, do you want to take that?
Yes, so we do measure children who are subject to a child protection plan for a second or subsequent time within the past 5 years. So we keep an eye on that. That has increased to just around the 30% mark at this moment in time. It was 28%. Yeah.
Can you hold the microphone closer?
Oh, right, sorry. I always wondered if it's my accent or I talk too quiet. But got a couple of translators here. But so it's around the 20, it sort of jumps between 20 and 32% at the moment of children who are subject to a child protection plan are, have been on a child protection plan before. So we have audited that recently, and so mainly it has been an escalation or an escalation in risk, really, that there's additional risk, so it's a different type of risk that the family are experiencing. Obviously there has been an impact from COVID over the past couple of years, and that families who have had support or have had plans for families to be supported in their communities by their families without the support of social services, and during COVID that wasn't possible to gain that support. So we have had to see some impact there. So we are hoping that now reduces as services reopen.
Thank you.
Yep. Sonia.
Tanya, Tanya and Sonia, I get confused. So just to kind of reiterate what Siobhan is saying here, that we do child journey audits every month. That's team managers, service managers, the AD, and either myself as director always do a child journey every month. On top of that, we do thematic audits, is what Siobhan was just referring to, and we've picked up a bit of a theme and we want to do a deep dive and really look at what is that theme telling us, and then we pull all this together in a quarterly quality assurance report that comes to both Sonia's leadership team and to my directorate leadership team, where we look at what is the last quarter telling us, what do we need to do differently as a leadership team in terms of really make that change and difference to our children and young people in Shropshire. And Ofsted said that we've got a really robust, solid quality assurance framework here in Shropshire. And in fact, we have other local authorities come to Shropshire and want to understand what we are doing in terms of our quality assurance and framework. So I hope members, you've got some assurance there in terms of how we not only look at children's case files, but look at themes and what we do about that theme moving forward. And maybe in future, we could perhaps share with you one of those quality assurance reports to kind of give you the overview in terms of all the work that goes on month by month, in terms of checking and challenge the service, in terms of what we're doing with our children and young people in Shropshire.
The last quality assurance Q4 report was included in the background documents, so the full analysis.
But
It's a lot of detail.
can I just ask on that point, so I read the report and it says sort of on the repeat patterns that showed families were not engaged with the services when stepped out. So I'm just checking, is that on the family side, have they chosen not to engage with what was on offer, or is that the result bit of COVID, a bit of everything else? And what are we doing to try and improve that engagement, I guess?
Right. I mean, when we can't force families to engage with us, and when it's, we need to work with consent when they're not on a child protection plan. So at a child in need level, or we have closed the children's social care and we are then open to early help, then it's voluntary. Then we do encourage engagement. So that's when we talk about families not engaging with services. Sometimes it's that they've had state intervention in their life for social services intervention and they no longer want that. But what we find is the earlier that we can work with families and giving families the right help at the right level, it prevents escalation, it prevents children becoming looked after or going on to a child protection plan.
Okay, so this is probably the wrong place to be asking this question. However, I think where we want to be, and this isn't really down to you, it can't be just down to you, it's part of your ICS work, but I think it's appropriate to mention it. Because I think, you know, the monitoring of individual outcomes is key to all this, really. And we need to be moving towards a position where we can actually monitor those performance indicators. So if you save that thought and take it with you to your ICS, I think that would be really helpful. And thank you very, very much indeed. You've done really, really well. Is that, have you finished with it now? Or?
I'll finish with you on. I think.
Okay, thank you. The drink now. Apart from, yeah, and glasses round when you finish. Well done. Thank you.
So just to save time, I'll introduce Jeanette. Jeanette is Jeanette Hill, she's Service Manager for Compass, which is our front door, the 2 assessment teams at the front door, and Trees, which is our exploitation team.
Okay, thank you. So that's on, isn't it? Yeah.
Can you sort out the slide, Daniel, please?
On to slide 7, Daniel, please.
Yeah.
Slide 6, sorry.
Yeah.
Back one.
Back one.
Sorry.
There can be a slight delay with.
It's all right. Thank you, Daniel.
Okay then, so just put into context, a social work assessment is a statutory assessment of a child. So this is determined in statute. So that means we have a duty to assess a child where they meet one of 2 criteria, which is outlined in the Children's Act 1989. And that is either that a child is identified as a child in need, or a child is suffering or likely to suffer significant harm. So if the child is referred into children's social care and they meet one of those definitions, we have a duty to then conduct an assessment of that child's needs. The timescale for completing that assessment is prescribed nationally, and it's 45 working days. So that's from the point of referral. So it is a regional and a national indicator, and that data is collected. Next slide, please. Okay, so this next slide really just gives a snapshot really of the total assessments cohort. So predominantly the assessments are conducted by the 2 assessment teams, and those are new referrals that come into the service, but all children who are open to children's social care are subjected to regular assessments. So that's what this data shows, is that total cohort. So as we can see, our overall performance since the start of the pandemic, which we benchmarked from March 2020, we have seen a steady decline. So in 20 to 21, that was 18% of assessments were conducted outside of that 45 working days. And the year after, so 21 to 22, it had deteriorated to 28%. And current data has shown us at 29%, but having looked at that more recently, it does seem to be an improving picture currently. Okay, next slide, please. I'd just like to say, prior to the pandemic, we were very strong in terms of our timeliness of assessments. And as this next slide shows, really, there's been a number of factors that have impacted really on our performance. So these would include increased demands at the front door. So it's been quite unprecedented times really, and we couldn't really predict those ebbs and flows that we would normally see prior to pandemic. We could kind of predict which would be our busiest periods of the year and which would be our low, but as we entered into the pandemic period, it was quite unpredictable really. So we did see increased demands at the front door, and also in terms of our disabled children's team, they saw a 78% increase of new assessments in 2021 as compared to 2020. And 1 in 5 allocations across the social work teams are actually open in the disabled children's team. So that just kind of highlights the increased need and demand for that particular service. As already mentioned, the periods of lockdown, as we know, most other agencies were not doing face-to-face visiting, so they went to virtual means of supporting families. And those support services either closed or they reduced their operating models.
which did then lead to difficulties for our social workers in gathering information needed to complete a full holistic assessment of the child's needs. So that did impact too. We know there's been an increased complexity of needs, so we can see that from the number of our care proceedings that has significantly increased over the last couple of years. And also we've seen a number of children subject to non-accidental injury and, you know, other quite complex features of concern. We've seen a reduced capacity within our own systems, especially in disabled children's team who've had issues around short and long-term sickness. We've had some long-term vacancies and we've just really struggled to recruit to those vacancies, and that is a national problem really around the recruitment of social workers. And then staff absence, which has been directly linked to COVID-19 infections and having to isolate, and you know, so we've had some staff that have been really poorly and they've taken some time to recover. Just to give an example there, in quarter 4 of 21 to 22, we had one whole assessment team were out for just over a week. So every social worker was infected with COVID, and that was during the period where it was a requirement to isolate. So you can imagine the pressure that put on the other parts of the service. And what we're seeing really is all this impact is an accumulation of assessments that need to compete in balance with that need to respond to the new work coming into the service. What these slides don't demonstrate is, just to assure you really, is that every child is seen in a timely way. So it is the recording and the completion of the assessments that we're seeing a downturn in terms of performance, but actually seeing the child and ensuring that that child's safe. We do that in a timely way.
Excuse, sorry to interrupt you there. When you say you do it in a timely way, what does that mean?
So children that come through a child protection route, so those that are suffering or likely to suffer significant harm, we see those children generally on the same day that the referrals come through. And for child in need assessments, our timescale is within 5 days, and so that child and family are seen within 5 days of receiving that referral.
So basically, there's a bit of a process goes on at the front door,
yeah,
and you take the most urgent first.
Well, it's not that they're the most urgent; it's the children that they're in most risk.
Well, yeah,
Yeah,
sorry,
yeah.
risk. Yeah. Okay, thank you. Ruth, you want to ask something? Oh, and Roger, sorry.
Sorry.
Thank you, Chair. Just on the nationally collected data on 45 days, how does Shropshire compare both nationally and regionally on that performance data? And I note that the the disabled children's team are more outstanding out of time scale assessments. How is that impacting on family carers, and what support is being provided for them?
Would you like to answer that
In
question?
terms of the benchmarking, so quite proud to say, prior to the pandemic, we were actually the lead across the West Midlands in terms of timeliness around performance assessment. We're not the only authority that's been affected by the pandemic, so all authorities really have seen a dip in their performance. And I'm just trying to remember the latest benchmarking tool that we received. I think we were about, was it 4th regionally?
Yeah, it's about 4th or 5th.
4th or 5th regionally, and I think that the trend really is seen nationally. I don't think we're out of kilter with what's happening in terms of the national picture. And I'm sorry, I didn't quite catch the second part.
It was a DCT question, and Steve will pick up in his overview, if that's okay, Ruth. Thank you.
Okay, Roger.
I've just got one more slide left. If you can just move that.
Roger had his hand up.
Oh, sorry.
Sorry. Otherwise, I'll have. Yeah.
Thank you, Chairman. And it's the disabled children's team. In the Ofsted report, I note there's a comment there which says some children have experienced significant issues with their mental and emotional well-being through the pandemic. Their needs in relation to this are not consistently well met by appropriate health provision. The local authority is mitigating the impact of this through spot purchasing. And then I also note in the report today, it says falls on allocation of social work assessments for DCT unless safeguarding concerns are identified. So
So Roger, can I split that into two? Do you mind?
If-
So one, I'm going to let Steve take the aspect that relates to DCT, Disabled Children's Team, because that's specific to Steve's area. But in terms of the health issues and the emotional and mental health issues that you raised in the Ofsted report, that particular comment relates to all children and young people where we've got identified emotional and mental health needs. And what they did was confirm what we told them in our self-evaluation, is that there are gaps in the provision of emotional and mental health support in Shropshire through the health services. So we know that there are real challenges, as we know from the scrutiny last week, people scrutiny, when both the CCG and BU, the CAMS provision, came to scrutiny, that there are real gaps in provision of services for children and young people in Shropshire around their mental and emotional health. So what happens for some of our children is that we then have to fund that privately or find a different way of providing some of that support. And so Ofsted were very clear that we were doing that and praised us for doing that, but clearly also said in the informal feedback that that's not a sustainable position for us as a local authority. And actually, we've been having that dialogue and conversation with the CCG to say that we shouldn't have to be paying for services that ought to be available to all children, especially those that are our looked after children.
I think the figure was about 600,000
Last year,
Yeah, so you know that's a big.
the words unsustainable does come out later in the report today, and it raised a lot of queries with me in that children are important. Shropshire Council, if needed, will have to find that money. I don't like to see unsustainable because we need the children need us. If the health services are not able to, then somebody has to pick that up.
without a doubt, Roger, and that would never, that's not the purpose of them using the word unsustainable. What's unsustainable is the amount of the impact on children. So without that being supported and without that being addressed, then they become adults then who have needs, and you know, you continue that cycle. We will always bring a child into care if that's what they need. We will always respond. We will always make sure those needs are met, and you know, Tamara is extremely clear about that, as is EMT. However, children are best looked after in their families, and if we can support their families in the best possible way, which is to meet their mental and emotional needs as one aspect, then those children are better off there. And what's unsustainable is just keep bringing children into care and then not having their needs met, and then becoming adults who need support long term into their future. That's the element that's not sustainable. It's not a financial unsustainability, although there is an element of that, because it's extremely expensive, you know, and that money could be better spent meeting their needs in a different way. And that's the position that we need to get to by working with the ICS.
And I, just going on from there, Roger, we had a very interesting feedback meeting. We rejected the mental health report from the CCG. It was shameful. And, you know, I, like everybody around this table, want to do the best for our young children. And the most important thing for their outcome, I think, for their outcome and well-being in life, is to actually be seen and have a plan as early as possible. And the CCG are absolutely failing our children. We are doing the best that we can to help our children. But what I'm hoping will come out of this, and I'll give my little spiel at the end when we come to the recommendation stage. What I hope that come out of this is actually better partnership working with the ICS, because we have to find a way to help these children. You know, these children are suffering because they're not getting help early enough, and that is not all, you know, it's not down to us. We need to try and help them get the help they need from the health service, or now we are part of it because we've got the ICS. There you go, Roger.
Yeah, I did view the scrutiny last week, and yeah, I noted your point.
Yeah.
But the second part, I think, was on page 5 of the report, where it says falls on allocation of social work assessments and this was agreed at Directorate Management Team on June 2022. What does that actually mean?
Can I ask Steve to answer that, 'cause it relates specifically to disabled children's team, and he'll address that directly. Okay.
Okay.
Jeanette, do you want to take your last slide?
Okay then, so in terms of the assessment team, we are starting to see an improving picture in terms of our timeliness of assessment. So as at the 23rd of June, there was just 7.3% of assessments open that were outside of those timescales. So we've introduced a number of measures really to try and drive performance in the right direction. So some of those measures have been increased management oversight, particularly at the front door. So scrutinising contacts and referrals and making sure that children come into service that actually need to. Tracking of social work assessments, so monitoring those using our data and having work action plans with individual social workers, making sure they have the capacity and space to do those assessments. Focusing on recruitment in the assessment role, so we're doing some targeted recruitment to try and help improve our capacity by filling our vacant posts. And yet to be embedded, but certainly a lot of work has been done around this, is the creation of a Compass Early Help Hub. So again, that will be a measure that put in place at the front door, which hopefully will mean children receive the right answer at the right time, therefore reducing the demands that come into children's social care, because they'll have access to earlier help and support, which we know is of great benefit and improves outcomes for children. And that's my slides completely.
Thanks, Jeanette.
Thank you. Well, 2 questions, Robert, and then Julia, and then Ruth.
I suppose I just had a couple of questions looking at the report. It was talking about there's going to be workshops on understanding of proportionate assessments. Obviously, that implies some of them are disproportionate. I'm hoping I'm making the judgment that the assessors are trying to do everything they possibly can for people, and it's disproportionate in terms of this sort of so much support allocated and so on. I'm just wondering sort of how widespread that was as an issue. And can you give sort of an idea, an example of a form of disproportionate support along those lines? I suppose my only other second one was around the recruitment. It was, what sort of figures are we talking about in terms of the assessment teams are missing? And we're talking about increased recruitment efforts. We've heard in other departments what sort of things that means. I was just wondering what that means in terms of this team as well.
Thank you, Councillor Macy. So we've added to our presentation some workforce slides and can give you a bit more detail about that at the end, if that's okay. Jeanette can take the question about vacancies in her teams as well. Jeanette, if you want to take the question about proportionality and then give an example of like the 10-20 day breakdown and all the rest of it as well.
So when I talk about proportionate assessments, obviously the guide is 45 working days. It doesn't need to take 45 working days. Some years ago, and I forget the actual date, we had an initial assessment, which would be 10 days. And then if the family needed a more in-depth assessment, that could move into a core assessment. So we were given another 35 working days. So there was a change in regulations, which meant that it just amalgamated those 10 and 35 days and introduced a 45-day assessment, which sadly meant that social workers who were under extreme pressure would probably take a little bit longer than perhaps they would need to do under the initial assessment route. So I want to try and reclaim that if I can, and try and introduce better practice, if you like, with social workers, that not every family needs a 45-day assessment. Some families actually have 2 visits. Speak to agencies, you can identify quite quickly what support's needed, and do that assessment in a much more timely way. But just to put in context, not all our assessments are disproportionate. So I do have the breakdown. So in terms of timeliness, according to our last chat data, 48% of assessments were actually completed between 1 and 10 days. So actually the bulk of our assessments are actually completed quite quickly. And when we talk about overdue assessments, 9% were between 46 and 50 days, so just outside of the 45-day marker. 4% were between 51 and 60 days, and just 3% were over 61 days. So we are talking small portions, and actually the bulk of our assessments are conducted pretty quickly. But I'd like obviously to see all of our performance good and the families really to have a much sooner conclusion. You know, not you know, it's a bit oppressive really, if you like, to have a social worker that's not needed in interfering in that private family life. So if we don't need to be there, we need to be doing timely assessments, putting in the support and stepping away from those families.
Thank you. Julia, and then Ruth, and then Joyce.
Yeah, so thank you for this report. I think it goes a long way to answering questions that we were going to ask you. So thank you for halving the number of questions we can bring to the table. And throughout really, the business about which statistics have been chosen could really have answered a lot more. So just as you said, if the comparison went back to pre-COVID, it would demonstrate which of these issues and factors are COVID related and which are not, because there are other trends going on. And we believe you that some of these are COVID related, some are not. But if you just added in that 2018 and 2019, we'd be able to see it with our own eyes. And I think the assessors likewise would do so. And the 4 issues we're looking at today have been brought here because they are anomalies. So while I accept that some of these issues like COVID absences and the closure of or the reduction of statutory services during COVID, they must have affected all areas. Surely not every single council has had 4 areas that need additional work. So the reason we're looking at these 4 is because they are anomalies. It must be exceptional, unusual, different. And in particular, when we get onto the last one, looked after children, we are an outlier. And I think our job is to unpick why it's an outlier, what is not the factor that everybody's had, is there anything we're doing differently or could do differently. And I think really what comes through strongly particularly is the issue of recruitment on the disabled team. And I would be hoping that you'll be looking at some market forces to enhance the uptake in that team, because although the statistic is really worrying, 78%, if I've understood correctly, that only makes up 1/5 of the assessments that are outstanding. But that's the problem you've got, is not the number of children that affects, but the type of children. So they sort of, they hit the threshold twice. They're in need because they've got a problem, and they also qualify as being in need because they're disabled. So it's almost as though the children who need us most are the ones who are having to wait the longest, and that's not okay. So we need to really double our efforts on that recruitment. We've saved money with the vacancy, so I suggest we roll that forward as a market force supplement to get those posts filled. Now, my last question, if I can find it, it's the same question as Roger Evans. I'm a bit disturbed by the wording about pausing allocation of assessments. I'm hoping I've misunderstood it. I'm hoping you're not going to stop the clock because you don't like the stats, and I would like to be really sure that that's not what it means. Thank you.
Julia, I'm going to take those questions if that's okay. Most of that will be answered by Steve when he talks about DCT and what's kind of happening. And I think it's important to note that the children that are open to DCT are not necessarily open to us for both reasons. A small proportion of them are. So a small proportion of them are open because there is significant harm in their families and they have a child with a disability. That's a small proportion. The vast majority of children open to disabled children are open because they are under Section 17 of the Children Act 1989 by virtue of having a disability. That doesn't mean to say that they are families where there is harm present, although obviously what we're concerned about is that without the right support, then that harm can then be an unintended consequence. In terms of the reason that the 4 aspects were chosen by Cabinet, I think it was because those were the 4 areas that, you know, we weren't performing well or as well as we are, because traditionally we are a very high performer across all of our performance indicators, and we're not outliers other than with looked after children. So I think actually in terms of assessments, it's not unusual in the West Midlands for local authorities at the moment benchmarking to be getting 62% of their assessments in on 45 days. That's the kind of bottom end, and as I say, we're benchmarking about 4th or 5th. We're used to being 1st or 2nd. Jeanette's not happy with that, I can assure you, and it stresses her out hugely. So, you know, we are working on kind of, you know, moving that forward. I think there are areas where, for example, needs, she will talk to you, it's a sticky one. It's been stuck for a while, and we benchmark right in the middle of average nationally, And it's a national challenge to kind of move that forward, etc. But we'll talk to you about that in a lot more detail. So where we are an outlier is looked after children, and there's a lot more detail that Siobhan will share with you, because we do understand it more, not completely, why that is the case.
Could I just briefly say that two of the responses you've given today, which have been very reassuring, if you could disaggregate that data, that would then be out there. The two being, you know, the proportion of disabled children who have one issue and the ones that have two. But the other one was the business about, although the assessments might not have been finished in 48 days, the visits had been. Now that will be pegged through your child's journey. So again, that could be included in the data as that reassurance that the work of the child has been done, but the paperwork is lagging. I wasn't sure, you referred to it a few times, whether or not that meant the referrals had been done. That wasn't the bit I'm not clear on. But I do think where you've got this very reassuring response, please can we have that in the data, and then it, you know, just moves us all forward, doesn't it? Thank you.
Okay, thank you. Ruth's next.
Now we're on assessments, Chair. May I go back to my original question on assessments and and link to audit? So, do you do any additional auditing on those overdue assessments? Are any of the interventions higher than perhaps they may have been because the assessments are overdue due to the delay?
What do you want to take?
Yeah, so I think Siobhan covered it quite well really when going through the child journey audit tool. So there is quite a good section on assessment. So assessments are scrutinised every month as part of that auditing activity. And one of the things that's looked at is the timeliness. So whoever does the audit will check to see if that assessment's been completed within or outside of timescale. So as Siobhan stated, you know, if we're picking up any particular patterns or themes, that will come out in the quarterly report, and then we can kind of address that. So it could be individual practitioners, and if that's the case, then that's addressed appropriately with that practitioner. Or it could be, as you know, some of the things that we've mentioned today in terms of some of those impacting factors. And we know that capacity is quite a big impacting factor for our social workers, and it can be quite a fine balancing act really. So they're trying to manage the new stuff coming through the front door, and we have seen an increase in child protection work as opposed to writing up an assessment form, you know, and it is hard for social workers really to get that balance at times. So it's in no way dismissing the issue of performance. Obviously we're working very hard to address that, but to provide explanation really. Sorry, I missed the second part.
Yes. Are the interventions perhaps higher than they may have been if the assessments have been completed on time? Or do you not collect that data, or don't you know, work in progress?
So would you like to pick?
I guess it's hard to answer, but I would say that the outcome for the child is not impacted by how quick they write the assessment form up. And actually what we find is the intervention is being provided ahead of completing that assessment. So, you know, if referrals are needed to other agencies or there's forms of support needed for the child, that there's no delay in that aspect of the process. That's put in place for the child with CAM.
Thank you, that's reassuring.
Okay, so Sonia now wants to just come back with some information for Julia.
So Councillor Buckley, my assumption was incorrect, and I'm really sorry because I couldn't pick this up, but all of that benchmarking data is in the quarter four report that went to Cabinet, so I kind of assumed that would have been kind of available, and the performance report with the benchmarking is also in that. So the report that went to Cabinet has got that. That's the Cabinet report of June the 8th, but I can send it to you directly if that's helpful.
That's great, thanks.
So we do use that benchmarking data, and obviously what we've not done in this report is expand on that benchmarking data because we were looking at our own performance. But that's a lesson for me in terms of actually we need to give you that context for this committee. So thank you.
Okay, thank you. Joyce.
Thank you. I'd like to ask you a question about staff actually, because staff are definitely key to on-time assessment. What I'd like to ask is, do the same caseworkers stay with the same family all the way through when they're with us? How short are we of full-time staff? And the other question is, do you think that we need more work, we do need more financing in this area, but how do we get those people that we lose? How many people do we lose? How many do we retain?
Thank you, Councillor Barrow. I'm going to answer part of that question, and then I'm going to let my Principal Social Worker for Workforce and Development at the end of the presentation answer part of it as well, because she's got some of that data. So no, the same social worker doesn't necessarily stay with the child right the way through. So there are quite specialist aspects to the work that social workers do. So they do have transition points at various points in the child's journey, particularly going from assessment to case management, and then if they become looked after, or if they are open to our exploitation trees team, etc. So sadly, no. Sometimes that works for the right reasons, other times it is problematic and transition can be difficult for families. We always look to see where we can minimise transfer points, and we continue to sort of work at that as we kind of develop. Nationally, there are 6,500 social work vacancies. Ours are minimal compared to some other local authorities. We have challenges. Jenny will talk to you about that a little bit towards the end of the presentation. We are trying to provide incentives for people to work for us. We have got a retention payment in place. We've got a good offer for people. We're in the process of converting 6 agency staff to permanent. It's a difficult and challenging market for social workers at the moment, and it's going to get more challenging with the outcome of the care review and some of the information that's kind of coming out about that around the direction of social work practice. But we're competing in a very depleted national market. We're also competing in a very depleted West Midlands market because, as you know, Solihull, Herefordshire have real challenges around their service delivery, and they have a lot of agency staff being paid a very large amount of money, which any authority in that position would do and would have to do, but it is impacting on the rest of us in the rest of the West Midlands. It is being discussed at director level, it's being discussed at AD level, and it was discussed at national conference last week.
Okay, thank you.
Okay, thank you. So,
Okay, so I think we're going to DCT, aren't we?
yeah, okay.
Next slide, please, Daniel.
Thank you very much.
So I'll just very quickly introduce Steve while he settles down. This is Steve Ladd, Service Manager for our Disabled Children's Service.
And can I just say that, welcome Steve, I've known him a long time, we used to do the visits to Hazelbrook together. Was you remember that, won't you? Back in 2009.
I think we may have done some auditing together as well.
Yeah, there you go then. So it's nice to see you look after and retain our staff. Thank you. Right, carry on, Steve.
Yeah, not sure I entirely want to be in this seat, but I guess, you know, it's kind of following on from what Jeanette was saying and the general tender. So we've had a real slew of push-pull factors that have happened within the disability area in terms of capacity and demand in the team, and that has created some delays in assessments being completed in as timely a way as we would have liked them to be. That also needs to be seen in the context of actually the level, like I said, of the demand coming in. And I just kind of added in there for you that, for example, thinking about pre-pandemic and through the pandemic. So from the 1st of April 2020, there were 242 allocations open to DCT. By 1st of April 2022, there are 379. So it's an increase of about 137 children, 52% increase in open allocations. Within that, new assessments coming into the system have kind of increased. What we know, and there's emerging research that's coming out about the impact for disability, their families, particularly parent carers and the child with disability, of course, is that reduced ability and resilience that's occurred during that time. So there's had to be some very creative work that's happened with families in a very responsive way. But like Jeanette was saying just before, it doesn't necessarily rely on the assessment being completed to be doing some of those things. That's one of the challenges about that kind of competing demand that takes place. And when you have a situation within a team where the demand is so high, where staffing challenges do present themselves, whether that's short-term or longer-term sickness, unplanned absences, in that way, kind of leads to some further competing demands.
I don't know if it's right to kind of pick up on some of the kind of questions that were in before, but kind of thinking about looking at solutions to manage some of the anxieties. And as Sonia said before, quite a number of the children and families who are open in ECT are there because the parents, carer, or others have requested that it would be a really good idea to have a DCT assessment. They'd like some support, have an education, health and care plan, but there isn't an immediate concern around welfare or an immediate concern around safeguarding. And those are very rigorously looked at. More recently, there's a triage meeting that's been set up that happens on a weekly basis from the team managers from the disabled children's team and the front four team managers, which look at some of those new referrals that are coming in to also look at there another way, perhaps that some of those services can be brought in at that very first point before the allocation of an assessment needing to go forward.
So can I just, I think what you're politely saying is that some people are trying to sort of bypass the system to get an assessment a bit quicker. Is that what you're saying? Trying to leap over other people, or
I don't think
because it's slower?
Yeah,
is that what you're saying?
Yeah, I don't think I would necessarily say that, but what I would say is that the outcomes that they're looking to achieve might be achieved in a different way. It doesn't necessarily need a disabled children's team assessment. It could be a range of other things, and maybe about part of that absence or a longer wait for neurodevelopmental opportunity. It might be about what's available in the summer half term, as in terms of a short break, in terms of opportunity for their child with SEND. So it's about making sure that we have some of those key messages that are out there. So involved the local offer to ensure that that information is available. Working more closely with targeted early help to kind of develop that offer and to make sure that that's explicitly articulated for families and to kind of understand that as part of the triage process, which includes targeted early help as part of that meeting too. Kind of assist with that.
And just when people do people contact you directly, or is there front door with the disabled team? There's a front door.
It is the front door.
It is the front door.
One front door.
You have one front door.
Yeah, same as any other child referral or contact that all comes to the same place.
Right. So it's a shared front door, not just a disabled team front door.
Correct. Yeah.
Okay. Thank you.
Chairman.
Oh, sorry, Roger. Yeah, Roger and then Ruth. Yeah.
Thanks, Pete. Can I say, I think everybody around here, we congratulate the team on everything that they're doing, and we're not criticising the team. It's resources. Do we need to reallocate Shropshire Council's resources or anything like this? So that's some of it. But I see on this progress in 4.9, it says that September 22 for the compulsory health team being implemented. I presume that's what's being discussed here. So, but then pause on allocation of social work assessments. So does that mean that we're pausing those and then reassessing them in September to see if it does need the DCT, or am I making 5 or 7 from those 2 paragraphs together?
So there was 11 made out of that. So there are 2 different things for sure. One is a very short-term measure, and what we've introduced in the meantime is a triage, which is starting with our team managers from disabled children's team. An early help team manager is also part of that, as well as the front door team manager. Those happen on a weekly basis. The pause on the allocations for disabled children isn't just that we're not taking anything, it is reviewed. All of those contacts are reviewed, and contact will be made with those families every fortnight to ensure that there is no escalation or concern. We're not losing sight of those, and we will allocate that at the quickest opportunity. It was only agreed for a month to try to pause and bring back some capacity for the assessing social workers to write up some of their assessments, not missing the need that's coming through the front door. So the triage, the reviewing and the contact to the family kind of the way that we try to keep a grip and a hold on those new referrals coming into the system. whilst we look forward to the future in September.
So from a workload management perspective, what's very worrying for me is having caseloads of say 30, 35, 40, not knowing whether that social worker is able to have the capacity to see that family, maintain contact with that family. So this pause is to say, well, we know where those assessments that are waiting are. We can maintain contact with the families. We can work out whether they're getting, the issues are increasing for them. We've got management oversight of them, and it's in a very controlled and managed way. If those families are just allocated out, we end up with very stressed social workers with huge caseloads who then haven't got the same level of oversight. So it is a short-term management oversight measure for my assurance to make sure that we've got eyes on those families and we're being honest and transparent with them. There's no point me allocating an assessment to somebody and that social worker is not going to get out and see them for 6, 7, 8 weeks because of their workload. So what is much more transparent is we say to the families, you're there, you're on a pause, we will allocate you as soon as possible. We'll keep you in touch with how quickly we're going to, get you a social worker who can come out and then see you very quickly. And it's a much more transparent way of working with families. These are not families that are in crisis. They're not families that are at immediate need. They are asking for support for their children from good term. And there are often other ways of getting that support in, not just through a social work assessment.
Okay, so yeah, I have got you. So I've got Ruth first and then you, Julia.
Thank you, Chair. Can I ask, Steve, is there any correlation between overdue assessments and education and healthcare plans that are not up to date?
So I work really closely with the SEND and team as well. In fact, I'm part of their, I'm the workstream lead for the Education Healthcare Plan Quality Assurance Group. So there's a really good connectivity between those things. We have recently appointed a designated social care officer. We're one of 30 authorities really in the country that have taken that step ahead of the Green Paper. That's really, really positive, I think. And what that does is help to provide us with that reassurance that the assessment and the social care contribution to the EHC plan, whether that is the review, annual review, or the initial education healthcare plan, is timely. And there's been a significant amount of work on that. And the DISCO, designated social care officer, is going to be doing an audit as part of her work plan around that particular aspects of building into the quality assurance framework too. So there's some real, so there's absolutely a correlation, but there's something that we're really ahead of the game on in some ways with bringing in the capacity of a designated social care officer.
Thank you.
Okay, Julia.
Yeah, thank you for the honesty around the triage to manage the depleted resource. But I have 2 questions. So would you pause those assessments if you had a full team of assessors? So would you choose to do this in terms of what's best for the children, or are we doing it because we have no choice? My second question is, because the disabled children fall under the section 17, have a duty, so there is a statutory requirement to assess them. So how do we square that circle if we're choosing not to because we've triaged them out of the priority, yet they automatically trigger a section 17 because they are disabled?
So no, they don't automatically trigger an assessment. We have a duty where the parent requests an assessment. That is the actual duty. So quite often we are able to triage out because what we can do is signpost and support families to access the support that they need without having. We have to remember that an assessment is a highly intrusive process, and actually the vast majority of parents don't want one. And if they can avoid it and they can get the services that they need, what we assess for primarily is those more specialist services for the more complex children. And that's primarily the purpose of a social work assessment. So the triage is to say, this child's got additional needs, they would qualify under section 17 as a child in need. Is there a way that we can get the right support services into that family as part of the community-based services, community-based offer that we've got here in Shropshire, and that will actually meet that family's needs. If the family then say, well, actually, it's not meeting our needs, or no, we do want a social work assessment, then yes, we have a duty to assess. We will never not assess. What we're saying is that allocation might be slightly delayed for a few weeks at this moment in time. If we were fully staffed, it would still be a challenge at the moment because of the volume coming in. And I think that this is about us as a council acknowledging that disabled children have been disproportionately affected by COVID, by the pandemic, by the impact of isolating that with their children, not having the same support networks, etc. And I think this is going to be a longer term problem for our families with additional needs. They are exhausted. They have used up their reserves of resilience. And as a system, so that includes our health partners, our education partners, we need to look at what is the kind of longer term supports for our children with additional needs, particularly those that are more complex, but also those that have really missed out. We talk about babies not being able to have accurate speech and language at 1 and 2 because of masks. Well, imagine the impact on a child with additional needs who can't communicate. So I think it is a major indicator of a wider problem, is what I would say.
Thank you. Can I just check? Do you think I've understood it if I would say that it's almost like an informal assessment that is being done by the qualified team to work out that this is the support service they would have got, but we can do it in a quicker way?
No, it's not an informal assessment. I think it's a conversation with the family about what it is they actually want. Do you want an intrusive assessment?
It's a shortcut, isn't it? We're getting to the same place, but for some families.
But I think it's the same as anybody with any child, whether you've got a child with additional need or not. If you could go and get a youth group for your child and that your child's going to be happy at that youth group, then why would you need an assessment to access a youth group?
Yeah. So
Actually, what if I need is specialist overnight support because my needs of children is complex and I need an assessment to understand what that support needs to look like.
Yeah.
So I think what we're trying to do is have those conversations with parents about what is a normal parental function, which is this is you need a bit more information about what's out there because you've got a child with additional needs versus actually you need a statutory intervention. And I think it's about remembering that a social work intervention is state intervention. It comes under the statutes, so you're actually going into a family's life on behalf of the government effectively, to actually understand what's going on so that you can understand the type of support they need. And that means you have to understand the parents' functioning, how they parent their children, how they code, what their mechanisms are, etc. It's very intense. So where a family doesn't need that, then how do we get them to right support?
Just one last thing, I promise I will let go. And I really resonate with what you were saying about the families being exhausted, and we have a lot of other stories about carers on their knees. And I wonder, is there any join up with, I don't know whether it comes under adult social services, because we know there's actually quite a delay now for carer assessments. So carers are on their knees and need respite and support, just as you've identified for the parents of these young people. That's also true for carers of adults. I don't know how that joins us across the piece, but just as you said before, because other services are shut down or reduced, you're feeling the pinch, and I think that could be another example of that. How does that join up? Is that an adults service, and are you able to have those conversations around the support?
So what is different in children's is that the carers assessment is incorporated into the social work assessment. It's part of the family assessment process.
Yeah. And I think the care package that my mother-in-law's got is actually being delivered by people who usually look after children. So, oh, right. Yeah,
That's where they've all come.
Not lots of lollipops. Right. Okay. Thank you. So, yeah. Is it something? Oh, sorry, Leslie.
Just quickly on social work, I'm sorry. On social workers, the shortage, which is a national and especially West Midlands, as you say, what has happened there that's made this a functioning process to a big problem over a short period? What's happened to all the social work? Where they all gone? Or
if you've got an hour, I can give you the short answer is I think that there are a number of contributory factors. I think it's extremely stressful, and I think that as a profession we're not as good as we need to be, and we're working on it in recognising the sort of secondary trauma that social workers experience in the work that they do. So a lot of social workers exit before they're 5 years qualified. We've seen that really increase through the pandemic. It's starting to happen prior to the pandemic. I think the national appetite for social work is not great, particularly on the back of some of the child death reviews. and the media kind of attention that the profession gets. It doesn't bring out its strengths, it brings out its challenges. And, you know, a number of social workers are actually personally, you know, attacked. I think that puts you off. I think it is a very challenging job for not the greatest pay in the world, as is teaching, as is nursing, etc. They're public services. There's no bursary as such anymore for social work courses, and a number of universities have stopped delivering courses. We've got our own apprenticeship program now, and we're about to get, we're 3 years in, our first cohort is about to qualify in January of this year, and they've done an apprenticeship where they've been much more practice based. So we're hoping that it won't be quite a shock when they go into practice. Whereas if you've been university based and you've only done your placements, it's quite a big challenge to then go into frontline social work practice. But as I say, I could answer that in a lot more detail if you had longer. I'm really conscious that the main agenda item, which is the number of looked after children, we haven't even got to yet.
Thank you.
Right, right, okay. So, oh yeah, Steve's itching to get off the hot chair. Help yourself to a drink if you want. Vanessa now.
So whilst Vanessa's getting to the microphone, Vanessa Gray, she's the service manager for our case management team. So those are the teams that work with our children subject to a child protection plan and child in need plans.
So just to update members, at the point when the report was produced, there were 222 children that were subject to a child protection plan, and currently there are 234. So we've seen a very slight increase in the number. And of those 234, as you'll see before you, 7 children in 3 families have been subject to a child protection plan for 2 years plus. And we audited those children last month just to assure ourselves of what the situation was for them. And what we found was that one child had already become and looked after the child. So there's waiting for this child protection status to be removed. Another 2 children in family, their child protection plan had been impacted by COVID when services weren't available. There'd also been some loss within the family, and actually they've been escalated because of the concerns. They escalated into the public law outline process, which is the legal process, and they were subject to pre-proceedings as we determine. But positively for those children, they've worked well. They've worked really hard. Not the children, the parents have worked really hard. And so much so that the concerns have de-escalated, and we're looking to step them out of that process at the next review. And then for the final family of 4 children, the risks have reduced, and they are also likely to step out of, step down from child protection. Just in addition to sort of ensuring that we have assurance that we're working with the right children, I review every child subject of a child protection plan in my service on a quarterly basis, and I do that with the principal IRO, which is managed by Siobhan next to me. And in reviewing them, we're just wanting to assure ourselves that those children do need to be subject to a child protection plan, and if they do, what are the concerns, and do we need to escalate them? Do we need to step them down because concerns have reduced? Or do we need to escalate them up because we're really worried about those children? So just in summary, the numbers of children that are subject to the plan for 2 years or more are not significant. In comparison to previous years, in 2021 there were 8 children at the same point subject to the plan, and in 2020 there were 6 children at the same point that was subject to the child protection plan for 2 years plus. And usually children that are subject a plan for that length of time, we will have escalated them up into the PL, the public law outline. So there will be another process sitting alongside the child protection plan. So for those children, we will be so worried that we're thinking about moving those children into a legal process. And I suppose just to finally say that what's the issue, as Sonia said earlier, what we're finding is that some children are completely missing the child protection process, because at the point they come through as a referral, they're escalating straight into a legal process without missing out that opportunity to be managed through a child protection process.
So that was what the point I was going to ask, and I don't know if it's at the right place or not, but the big one in all this for me is you did the audit on the last 50 children that came in, and 80% weren't identified. So therefore, it follows on with your protection plans that your partner agencies, so maybe the doctors or the health workers or the schools aren't sharing information with us. Is that right, or is that what you were trying to say? Or
no, I think so, because I mean a number of children, I mean there are trigger events that will, and there are some children that have never been known to us.
No, exactly.
And then something will happen.
Yeah.
And depending on the seriousness of that, actually the local authority needs to go into straight into court.
But what happened with the last 50 kids was they sort of bypassed your bit and went, you know, straight there, and that doesn't usually happen. So usually I would have thought what would have happened, I don't know, is that if you were working closely with maybe the schools or health visitors, then they would perhaps, you know, pass information on to you and you'd do a protection plan, and then you would help those children from going into care.
I think our hypothesis would be, or one of our hypotheses would be, that over the last 2 years there has been a lockdown, and so in terms of services having eyes on children, there haven't been many services that have had eyes on children, and so some children unfortunately have been missed, and so at the point they come to the attention of the local authority, the concerns are so much so that a child protection plan will not safeguard them. You actually need to be sort of moving into a court process.
Yeah, so they've basically gone straight past your door.
Yeah.
So if I could give you as an example of that, we did through the Safeguarding Partnership a learning review over a non-accidental injury on a toddler. And so with our partners, the statutory process for a learning review is undertaken and everybody reflects on what happened. And for that family, the middle child ended up with quite a severe injury. So of course what happens if that child becomes looked after because of the injury, it needs to be investigated. The other children also become looked after, it needs to be investigated. Because if you don't know who's caused that injury, i.e. it's non-accidental, then you have to remove those children for that period of time, or that police investigation is happening alongside our health colleagues. What we learnt from that was that because the health visitor had been redeployed, the maternity check and the midwife had been redeployed, the maternity check post the new baby being born wasn't undertaken, and then follow-up health visiting visit wasn't undertaken, and both of those would have been points whereby that parent would have had the opportunity to say, I'm really stressed, I'm struggling with isolation, I'm struggling with my emotional health and my mental health and well-being, and we would have possibly have had the opportunity to get support in place. So that's really important cycle in terms of like learning, but because that came in as a non-accidental injury, those children go straight to become looked after rather than have the opportunity of a child protection plan, which they may have still ended up on the child protection plan, they may not have done if those other earlier checks had been undertaken and that parent had that conversation with that professional. That's helpful.
Thank you. So I've got Roger, Ruth, and then Julia. Roger, Julia.
Thank you. Sonia's answered part of it, because I noticed in the report that she went to Cabinet that it mentions there at the end of it there were 207 subject to a plan, 222 in this report, 234 now. So is can I use it, a measure of success? That a corporate, that
Yeah.
a letter protection plan is now in place, and it may prevent those children going into looked after children for us. So the more protection plans, in effect, is that we will reduce the numbers of children we hope will become looked after. Have I made four this time?
No, you've made 4, Roger.
Yeah,
Yeah, absolutely. What we would hope is, and so what we're hoping is that that is an early indicator, and of course we won't know until we've looked at it through audit, etc. That services are kind of coming back, that our partner agencies are referring in an earlier opportunity, and that we're being given that opportunity to work with that family. And obviously what I'd like to get to is where those families don't come in at all, but they have that kind of wider, universal and targeted early help offer, so it doesn't escalate to that kind of at all. But yes, that is possibly an early indication that we will start to see that. Obviously, that what then happens is it depends on how those families work with us as to whether or not that stops that child becoming looked after, but it does give them that opportunity to work with us.
Right, Jim. So that's where the health professionals, the police and everything can help us actually help the families if we know about them early enough.
Yeah. Yeah. Okay. Ruth. Sorry. Yes. So we've got Ruth, Julia, and then Robert. Yeah.
Well, it's the same area here, and it is complex with no, not a standard answer. I understand that. And actually, Sonia, your explanation has helped, because my question was, are we confident that there isn't any sort of creep in the threshold rising for reporting by partner agencies, or is it hopefully, or not hopefully, or is it because people just not being seen, the children not being, child is not being seen? I mean, both are not acceptable, either are not acceptable. I mean, 3, 4 not seeing a child.
So I think what we are confident in is that our thresholds have not crept.
Good.
So Ofsted looked at them in detail. They spent 2 days in the front door and with the assessment teams, and our audits show that ourselves. Jeanette does a lot of dip sampling in the front door, and she audits thresholds on a regular basis. I think what we have learnt is there's been a lot of staff turnover with our partner agencies, and there's a lot of conversation happening around having to make sure that those new staff have been on threshold training, who understand the threshold document, and how to refer in, etc. So we have had a very successful joint event with our health partners 2 weeks ago, I think it was, Tanya, where we started to have that conversation and that dialogue. And what came through from them was the whole health system has had quite a significant churn in staff over the last sort of 2 to 3 years. So there's a lot of work across the partnership to do with making sure that everybody's had access to the right training and development. So threshold creep was one aspect of your question.
Well, is it threshold creep or just the child not being seen, or a bit of both?
Yeah, and so what we've also done is some quite significant pieces of work, particularly with health visiting, midwifery, Shropcon, and those kind of community health-based services, to share our audit outcomes. Again, Jeanette doing them at the front door, saying, you're telling us that babies are being seen, but actually this audit has shown us that X number of children haven't been seen. So we've done a really, I think, strong piece of work jointly with them to say, actually, you need to make sure that we've got that kind of assurance absolutely clear right the way across. What I would say is we are of the view, and Ofsted confirmed that view, that once children are in our front door, they get a good partnership response. So I don't want anybody to think that partners aren't doing their bit. I think where we've had the challenge through COVID particularly, and just before, is that earlier aspect. So that point whereby families are thinking, something's not going quite right here, how do I get some support? How do we strengthen that aspect for our families? Actually, the practice from our health visitors, our school nurses, our midwives, probation colleagues, drug and alcohol colleagues, the whole range, once they're in our system, is actually very strong.
Tanya, you mentioned under 5s, but later on in the report it refers to non-accidentally injured under 2s, and it's increased nationally. And I think that's really quite concerning. We've all seen those dreadful stories on the incidents on the news. It's dreadful to have that locally.
Okay, that one, I agree, and the 2 years coincides with COVID as well. Right, Julia.
Yeah, so as I understand it, where things have gone wrong in the audit, we can trace back and find the gaps, can't we? Some of them are due to COVID, some of it's to do with churn. As I've understood it, when the system works well, the partner agencies refer, as in they flag a problem to us. But I think the gap might be, I'm not entirely sure, who's responsible for overseeing all of the system and spotting that there is just a gap. Not that a problem was flagged by an active agency, not looking backwards because we need to, because it's gone wrong, but on a regular basis, which of these agencies, is it us, that should be looking over the piece and saying, they haven't flagged it to us, but I can see here there's a hole in the thing. And is it that a computer can do that? Is it that it is happening? Or is that the missing piece? If it works, it works. If it doesn't work, we go back. But we're not actually checking for the holes.
I think we are checking for the holes. I think the holes are quite well known. The Safeguarding Partnership, Community Partnership, has that kind of responsibility for the oversight of safeguarding children. A lot of the holes are kind of identified, if you want, through the priority groups that sit underneath the Community Safeguarding Community Partnership. I think the holes shifted during COVID, so health visitors would never have not visited, maternity would never have not visited, etc. And in some local authorities that didn't have to happen because obviously they have much larger NHS footprints. Some of the big cities, etc., have got more, so they didn't have to redeploy their frontline health visitors and midwives in the same way that we had to in Shropshire. Some did, mainly the rural counties had to do that. So I think the gaps have shifted, but also that they're a combination of the outcome of COVID, but also the sort of longer standing sort of problems around, not meeting the emotional mental health needs of children is not a COVID problem. We've had that problem for quite some time, and it's grown significantly, I think, because of COVID. So I'd say in terms of the responsibility, yes, of course, it's our responsibility as a local authority, and that's what we work to do, and that's why we audit so much, so that we understand. But that is fundamentally also sits under the Safeguarding Community Partnership, which obviously Tanya sits on at the strategic board level, and our partners. Do you want to add anything to that?
No, I guess that kind of audit of the last 50 coming to our care and the 25 plus children that were under 5, that identified a real issue for us, which is why we called together really quickly the strategic leaders in the National Health Service around this is a problem. You are telling us that your health visitors and midwives are out doing face-to-face contact, yet 25 of our last 50 children have come into care with no contact at all, and they're under 5s. They then went back and did their cross-checking, and then re-audited, and then kind of put the principles out again to absolutely give now back to the partnership that assurance that health visitors and midwives are doing those really important face-to-face home visits, and not just accepting that a parent has declined, actually checking that through, similarly with the GP. And then having that really important workshop just 2 weeks ago, bringing together the practitioners across the Shropshire system was really valuable. We've got Fran Doyle on the call as well. Fran Doyle, as you know, is our head of service for early help, and we're absolutely resetting again that early help offer in Shropshire. Given that the last couple of years, we've kind of lost a really important relationship within the partnership. So Fran's doing some dedicated work, particularly, Fran, aren't you, with the under 5 cohort, working with the early years setting, our health visitors and midwives, reminding them around the importance of the universal early help offer, as well as the targeted early help offer, because the game in town is to keep our children with their families and prevent them having to come into care. So we've set Fran, the plans coming Fran over the next few weeks to kind of reset that button and work with the partner. Just say a few words there, Fran, just to kind of give a bit of information to the community. That'd be great.
Yeah, I think the important point here, folks, is to kind of oh, sorry, can you hear me now?
Yeah, crank it up, that's it.
Yeah, can you hear me now? Am I loud and clear? Excellent. So just to introduce myself first of all to everyone, my name's Fran Doyle and I'm the head of early help at Shropshire Council. I have been listening intently to the conversations that have been going on, and I think there is one key important factor in all of this, is that after a pandemic, we need to re-energise and reset where we are. And that's in terms of everybody's responsibility to deliver the earliest possible help to any family that needs it. So all of the data that we've been listening to today is vitally important in helping us to make our partners aware that some of it is currently not working the way it should be. So obviously from a council's point of view, we've invested £1.2 million in a new model, a new delivery model for early help. We've been instigating that plan over the last 12 months post-COVID because we knew this tsunami was on its way. So from a local authority's perspective, we've planned diligently, we've got the investment in. We've increased the capacity of our detached youth support team. We've increased the capacity of our targeted early help team. Now we've got to focus and concentrate our efforts on our external partners and their understanding of the responsibilities that they play. So we've got a plan of action in place. We're going to see it through. We need to market it early help. We need our partners to understand the thresholds and to understand the part that they play. And where they are struggling, yeah, just in terms of capacity, because I absolutely get it, that some schools, for example, will say to us, you know, currently today we've got staff off with COVID. Yeah, and we've still got families who have to have their needs met at the earliest opportunity. And so as a local authority, we will support those partners to pick up those families and work with them. So some of this is about resetting. We're already on that journey. So I think at least 3 times we've mentioned in the past fortnight that we've had building brighter futures. That's what we're calling it. We've had a workshop with our health partners. We're going to have another 3 of those events throughout the rest of the year, just to make sure that the rest of the external early help partnership can now join the party. So I'd be very happy to come back to either scrutiny or performance in the not too distant future to obviously provide you with some insight into how that's all going, and from an early help perspective, what the data is telling us around the successes that we are having and the improvements that we've got to continue to make.
Can I just say something? Thank you, Francine. That was very helpful. So I think what you were saying in a polite way was that you're going around our partners in all this, trying to get them to up their game. Is that about right?
I think that's about right. Yeah, a bit of arm up the back, but actually just talking about responsibility. What is your responsibility to support families earlier? And for some of our partners, you know, I absolutely get it. We've all got issues of capacity, so let's not put that in the way of supporting those families earlier. If the family needs support, then we have to get stuck in collectively.
Yeah, and just another question. So Shropshire Council have only got, I think, 1 senior school and 100 primary schools, but presumably you talk to all the academies, and very importantly, I think you must be getting around all the preschool, because this is where all this starts, you know, all the preschool groups. So you've got around all them as well, haven't you?
We are working our way around them, but it is a big system. I hope you understand. You know, we've got something like 150 schools, we've got another however many early years settings, but we do work collectively, strategically within the local authority. So we're working across children's social care, education and early help. And all assistant directors, heads of service for all of those areas of delivery get together on a frequent basis. So myself, Sonia, David, we're meeting regularly to ensure that we're up to date, not just strategically, but in practical terms, realistically, what is actually happening on the ground? Where have we got these gaps? What do we need to do next? What plans do we need to put in place to mitigate against the risks of children becoming looked after, or on a child in need plan, or on a child protection plan? Yeah, if they don't need to be anywhere near children's social care, then they shouldn't be.
Thank you. Yeah, Robert had a question, and then Roger.
Thankfully, most of the questions have been answered.
Yeah, sorry.
No, it's all right. It was all around the help and songs we heard before on the people that second plans and so on. That was around the families have a choice whether to engage, and that was kind of my thing when it came up again. Of we prefer not to see them in the system, but we need them to engage and so on. I suppose for me, the only question I had as well is, have we ever done a piece of work, this sounds daft, with the families that won't engage with this, almost like somebody independent going and talking with them? I know we'll identify what we think are the issues and so on, but it's with those families that they might not want to say to us or to the other partners. Has there anything along those lines or by our partners been done to try and identify those?
So not to my knowledge recently, Councillor Macy, and it's part of one of the functions that we want the Early Help Hub to do, is to talk to families about, have you had the opportunity to have some support previously? What stopped you? Is that because you don't know about it? Is that because you don't want it? You know, what are those kind of reasons? So one of the remits and one of the outcomes that we're going to be measuring through that hub is what has been that barrier for families in terms of accessing that support or working with early help or whatever previously, so that we can try and understand that. So that will be one of the evaluative criteria from that pilot in September.
Roger, I've just noticed we changed over the slide and changed the scene.
Yeah.
Yeah. So what I was going to say to everyone is, probably need to make a visit. So I don't know if we just go out one at a time or whether we actually have a 5-minute recess.
5 minutes.
Yeah, just because, you know, I'm quite desperate. So can we have 5 minutes, please, and then we get on to Roger's question. Is that all right? Yeah, is that all right with you, Amanda?
Yeah.
Yeah. Okay. Just let me know. She's starting to shuffle around a lot.
Now live again, thank you.
Right, thank you very much indeed. So, Roger, would you like to ask your question?
Thank you, Chairman. And it's to do with looked after children, and it isn't looked after children. I was in a school yesterday, and they got a Ukrainian child in it who is in reception, year 1. And the child is a little bit disruptive because the child's never been in school before. Child was brought up by his older sister. He's over here now with his mother. Neither speak English. They're having difficulty communicating. School finishes in a fortnight's time. That child will then be out of the system, out in a host family. And I do not want that child to enter our looked after children synopsis or anything like this, but is Shropshire Council, and I understand Help and Reading, for example, are providing help and assistance to schools for these children who are over here, visitors. We hope they can go back. But I am concerned that during August, these children could well be disruptive, cause problems, finish up with protection orders and looked after and everything like this. But is there any way that we are doing it? Have we looked at it? And what are we doing, if anything? Thank you.
Before anybody comes back to the official version, I know that there's quite a few Ukrainian families in the villages around where I live, and I've met them all. And loads of the Ukrainian families around where I live all speak English, and there's some older children there at college. So, I mean, there might be a way that, I don't know what Laura's doing, so I'm going to tell you that about families getting together and supporting one another, because there will be support there, I'm sure, for the various families, because, in the community.
Councillor Evans, I'm afraid I'm going to have to say, well, I'll need to get your response to that. So the support for Ukrainian families doesn't sit under me or my service. It sits under Laura Fisher, and I can ask her to do a response to that question. Obviously, if there were child protection issues, then they would come into my service. We haven't had any as yet. And obviously, if there were, then we would respond the same as any other child living in Shropshire. But I don't want to give you false information. So if it's okay, I'll come back to you and get Laura to do a response to that question.
Right then, so are you going to introduce?
So if we move on to the third aspect that we're going to look at today, our children looked after, and obviously what was of concern to Cabinet was a significant increase in numbers. So I've got my two service managers that lead on two separate aspects of looked after children here today. One is Siobhan Williams, she's the one sitting behind. She's the service manager for our children looked after, care leavers and our court team. And the service manager sitting at the front is Lisa Preston, who's our service manager for fostering, adoption, special guardianship and residential services. So one of you going to kick off.
Okay, just to set this scene then as to who are the looked after children. So children are looked after by the local authority for a number of reasons, and I'll go through them. One is where there's immediate action taken to safeguard a child or place in the care of the local authority. That's known as an emergency protection order. There's also where the council can share parental responsibility through the making of a care order or interim care order granted by the family courts. Also where the youth court remands the young person to the care of the local authority. A parental request where parents have been unable to care for a child and there is no other option, then we accommodate a child under what's called Section 20 of the Children Act. We have to accommodate children where a child's abandoned, where we have a 6 or a 7-year-old and they're homeless and we must be looked after. And lastly, where an unaccompanied asylum-seeking young person is under the age of 18. So in terms of the growth in looked after children, we have seen growth through the pandemic, and the figures there will show that. So we started off on 31st of March 2020 with 399 looked after children. That grew significantly through 2020 to 2021 to 504 looked after children, and 31st of March 2022 to 609. The data on the 28th June this year was that there were 622 looked after children. We have seen the increase in looked after children grow faster than the number of children ceasing to be looked after. even though the number of ceasing has risen faster in the previous years before 2020, and those figures there will show you that we are exiting more children this year than we did last year, but obviously our numbers of children who are coming into care continue to rise.
So in terms of sort of the numbers of children who started to be looked after, we've got 108 children who started to be looked after. It's important to note that 17 of those were accompanied asylum-seeking young people, and I'll come to that in a bit. And we had, so far this year, we've had 55 children ceased to be looked after. When I come to look at the ceasings, I can sort of talk to you about the forecast for that, because it's forecast to increase. The number of children who cease to be looked after is a forecast to increase this year because of some of the actions that we're taking to focus on those children. But in terms of us looking at the three areas where there has been growth in the numbers, so it's the numbers of unaccompanied asylum-seeking young people, and that's because we've become part of the National Transfer Scheme. The National Transfer Scheme started off as voluntary, but now it's mandatory, and local authorities are allocated a proportion of looked after children to take what they call from port. So that's those children who are arriving in boats from Kent to Portsmouth. What happens now is that those young people are placed in an accommodation centre. They don't have a social work assessment at port. They only have a Home Office interview, and we take them as soon as we can, as soon as they're allocated to us from port. So Shropshire's allocation this year was going to be sort of 45 young people. It then rose to 55. It's now reduced because our number of looked after children has risen slightly, but also the number of families generally, I think, in Shropshire who are asylum-seeking families has slightly risen. We've reached our 0.07%, so that means we don't have to take any new children probably until about October, but we do currently have 37 unaccompanied asylum-seeking young people.
Can I sorry, I was going to ask a question before you swapped over. So a couple of questions really. Paragraph 6.9.3 of the report. It says we've got 59 young people in residential homes. 34 of those are asylum seekers. So picking up on your first question, because the First Lady was talking about fostering, I would have thought, you know, we have Ukrainian families here, which in effect are being fostered by the community. So I would have thought that surely some of the asylum seeker children would have been fostered in the community. Are any of the asylum seeker children
they're in a different position because Ukrainian families have host families. They're not looked after, so they don't have to be foster carers. They don't have to be approved foster carers to host a Ukrainian family. Unaccompanied asylum-seeking children who are different to unaccompanied asylum-seeking families, they have to be looked after. So they have to be looked after either in registered provision, or if they're 16 and 17 years old, there can be in supported living arrangements. We have very, very few supported living arrangements in Shropshire that could meet the needs of our asylum-seeking young people. They're people whose main languages are things like Pashto, Dari, and you know, some of the other sort of African languages. They find themselves feeling not able to access some of the services that they would like in terms of worship, in terms of foods that they might want to buy, and in terms of sort of the communities that they might want to live in Shropshire. So they do have a small percentage that live in our supported board and living provision in Shropshire. But even with foster families, our children who are with foster families are not with foster families in Shropshire. They're with independent fostering agencies in the Birmingham area. But most of ours are 16, 17-year-olds and live
in supported living provision, mainly in Walsall, Wolverhampton and Birmingham. And for most of us across the region, wherever across the region we are looking after them, we are all using similar provision because this provision has become quite specialist and well able to look after these cohorts of young people and understand their needs.
So what you're saying is most of the 34 asylum seekers in residential homes are actually in Birmingham?
They're not in residential homes, they're in supported living arrangements. Yeah, sometimes 24. I would say most of ours are more Wolverhampton and Walsall.
Right, okay.
Because then they can still have easy access.
And they're predominantly older.
16, 17-year-olds. We've got 2 who are under 16 who've come through court, and we've got 1 who's under 16 who we've looked after for a long while, who was one of the children who didn't come through the National Transfer Scheme, dropped off by a lorry quite a few years ago.
Okay, thank you. Ruth, you can ask your questions.
Thank you, Chair. I'm just doing some background on accompanied asylum seeker children. Just for clarity, the Home Office interview, does that give any indication of their need? Or do you have to determine that by a social work assessment? I'm assuming funding follows, but not necessarily for their assessed needs, or does it? And unaccompanied Ukrainian children, are they automatically looked after?
We haven't had any unaccompanied Ukrainian children so far. If they were genuinely unaccompanied by no one, then they would become looked after. But so far, most have been, for the ones in Shropshire, have been with host families, so that's treated differently. In terms of assessment of need, though, the Home Office interview isn't an assessment of need. They do a provisional assessment of age, and they do an assessment in terms of the language that the young person speaks and the journey they've been on to establish that they are an asylum seeking young person, at least in terms of their initial story and their initial journey. It's for the local authority to undertake that needs assessment. It's why we usually sort of ensure that the supported living providers that they're with, unless they're kind of 17, almost 18, we provide a high level of support there. So it's usually 24/7.
And does funding follow? I'm assuming it does.
The funding follows for children looked after. So if you're a looked after child, it's the local authorities reimburse per night. It's usually at the end of the year. So if they're via the National Transfer Scheme, it's £143 a night. If it's not, it's 114. So that equates to about £1,000 a week for the ones coming through the National Transfer Scheme, and about 790 for the ones not. That does cover their accommodation costs, and it does provide some contribution towards the other costs that we have, like the cost of the social worker, IRO. It doesn't cover the whole cost, but it would make a contribution towards that. For the asylum seeking young people who become care leavers, the Home Office only pays £270 per week. It's quite a drop. The original logic behind that was that as they receive their leave to remain status, they are able to apply for jobs or apply for benefits, and they can apply for housing and they can support themselves. So the £270 was only meant to be a bridging small amount of money. However, some of our care leavers have been waiting now for 2 years for their leave to remain decision from the Home Office. The Home Office are currently dealing with applications from 2019. Some of ours do get it sooner. Some of the countries are fast-tracked, as they call it. So Afghanistani asylum-seeking young people at the moment are fast-tracked. But there's still quite a delay.
Thank you very much.
Okay, thank you. Julia, you want to ask a question?
Thank you. Yeah, I think it's a similar thing we've seen in the other sections, really, that the headlines are worrying, but the detail is reassuring. So again, I hope that I've understood correctly that although we are an outline for looked after children, within that, the numbers in residential care are nowhere near as high as those in foster families and connected carers. Would I be right in understanding that the financial cost is different in those settings, and that the desirability is better. You know, you talk about stepping down, so stepping children out of a residential setting into a connected carer. Is it this sort of phasing? Is it, if you had to put them in a league table, is it that there's a preferred outcome for these children, that we should be more worried about the ones in the residential and less concerned about the ones that have moved on to a family setting?
For a very small percentage of children, a residential setting is their kind of the right setting. I would say particularly for some of the children that Steve serviced, you know, children with particularly complex needs or very specialist needs, they often still have their family around them, and their family is still very dedicated to them and very safe and loving families, who still see a lot of their children. We have other children where their complexity of need is due to sort of severe trauma, and where their family connections have perhaps either been severed or aren't as safe for them. And we have other children where we would love them to be with a foster family, but there isn't a foster family available at that point in time, and so they're in residential. So children have different pathways depending upon their needs, and not all children who are in residential care shouldn't be there. And for some children, they might only need to be there for a short amount of time.
Sure, I suppose what I mean is I understand that this authority and most authorities have the drive to reduce looked after children, namely because of the price tag. But when you actually unpick it, some of that is highly desirable because of complex disability. And actually, under that same bracket, I think these connector carers belong, who actually seem like a really good solution. So if I've understood it, it's not actually looked after children we want to reduce, but it's a particular type of looking after for children for whom there might be a better solution.
I think particularly, I don't really talk about that when we get to bit about connected carers, but connected carers can look after children under a lot of legal orders that don't necessarily mean they need that big intrusive nature of state intervention. But sometimes the way they come into being looked after means they start with state intervention, and we're trying to work our way out of that.
Thank you. Yeah. Councillor Bartley, I think the drive for reducing the number of looked after children for any local authority is that the outcomes for children are best if they are with their families. It's not a price tag, and I think we need to be really clear about that. However, there are some aspects of care that are highly costly, and if you get the pathway right, they shouldn't need to end up in those high cost placements.
Exactly.
So I think I just want to be sort of clear, you know, the numbers we want to reduce, because where possible, either with their birth parents or with their extended family, that is where children do best.
I just think these definitions perhaps don't belie that, because if I've understood it, the word looked after children also includes those with connected carers.
It does, yeah.
Who could be that extended family who have in fact provided the stable home they needed at lower cost, but as a better act. So I'm just saying, as somebody completely lay to this topic, I think the word looked after children, I hear lots of conversations about it, but when I read this report, I understand actually some parts of what everybody describes as looked after are this other more desirable and less expensive pathways.
Because they are looked after.
Yes,
So at the point whereby they're assessed and their connected carers are foster carers, which Lisa can give you the detail, they are looked after children. However, there is an exit for some of those children called a special guardianship order, which means that you can move away from being a looked after child
to be permanent.
To be a permanent, yeah.
So don't know if you, in terms of our other reason for the growth of the number of looked after children, I think that sort of links to some of the other areas that we've covered today, and that's the number of children who become looked after due to risk of significant harm. So we do have a high number of children who are subject to care proceedings, and you can see on there that the growth of that from February 2020 has gone from 47, 79, 116. We've started to turn the curve now as we're coming into 2022, but it's very slow downturn. At the moment, where I think it's something like 84 live sets of care proceedings, 101 children.
that was the, you know, sort of like where we were at that point in time. And so it's a very high number of children to be intervening so drastically in their lives, because it isn't just the local authority that intervenes when you're in care proceedings. You've got oversight of the court, there's children's guardian, everybody has a solicitor. It can become quite adversarial, and everybody wants to know everything about every aspect of that child's life and those parents' lives and any relatives who are involved in those children's lives.
So I just want to make a couple of points here because I am conscious of time. I know when we discussed this before at Performance Scrutiny, and I was talking around the subject with Alan Mosley, I think the point we were asking really was, our numbers of looked after children have gone up. They've gone up disproportionately higher than our statistical neighbours. That was the point, and that's the thing that has been focusing my mind in all this. So when we went to, or when we had the People's Scrutiny, and we had the CCG, who are now not the CCG, and they were talking about CAMS and the mental health, and also we heard about, you know, one particular child who could have had specific health interventions to have kept them at home, but actually that didn't happen from the CCG, and so that child is now in residential care without much chance of being stepped out again. So part of this, and part of the question I want to ask, and where I want to get to with the performance indicators, is I think that part of the reason why there is a disproportionate rise in the looked after children, especially in the area of the mental health aspect of it, is because I don't believe that they're getting early enough help from the CCG, basically. I don't know if you want to comment on that, Sonia or Tonya.
So what we agreed at the People's Committee last week was to do an audit with our health colleagues, looking at the children that are currently in our care, because of the very small number of children that are actually actively receiving support and treatment from the Children and People's Mental Health Service. Likewise, we are concerned, and let's be honest, that both professionals, so social workers, GPs, teachers, parents, and young people themselves have lost trust in the current Shropshire mental health service for children, and so we need to reset that button. And there is different leadership there in terms of management over that service, and we need to reset the button to put that trust and confidence back in the service. The professionals start to re-refer the children back into that service. So we're undertaking that exercise within children's services currently. But I would add also, Chair, it's not just about mental health support for young people, but also for the adults, the parents that are parenting the children. If we get the support right for the parents, then they're going to be better parents to look after their children. So I think we focus a lot on mental health support for young people, which is right, but we need to not forget the focus of the support for the adults in that family life as well.
Yeah, which is, well, I did write some recommendations down earlier, and that is why, you know, I included everybody in that, because I think there is a problem with the delivery of some services from the CCG, in particular the catastrophic impact on young people of the care service. I mean, you know, so what I ideally, where we want to end up, or where I think we should end up, is with some proper outcomes and performance indicators that actually track the whole way through, and it's coming up with those that is going to be key to actually seeing any kind of improvement. That's essentially what I think. Julia.
Yes, I mean, I'm really grateful that Sonia sent me through the stats from that previous meeting. So for Q4 21-22, looked after children in Shropshire per 10,000 is 101. Our nearest statistical neighbours are 61.4, and the England average is 67. So we're not quite double, but we're, you know, pretty high up there. So I have 2 points. One is, and this is comparing us with our statistical neighbours, but we jointly commissioned that with Telford. So the question is Telford also an outlier compared to its statistical neighbours? And the second point is, just because CAMS may be failing and seems to have inadequate resource with the number of referrals, doesn't necessarily mean that it is the only reason that our looked after children is higher. That's a hypothesis, but surely we need to examine what other potential reasons there might be why Shropshire is so different to everywhere else.
Yeah, and that's exactly the point, Julia. I think it's only one of the reasons why. And what I want to get to is understand what other reasons are giving us this impact. Anyway, Sonia, you wanted to come back.
So Telford are seeing a rise in their increase in their looked after children in the last 12 months. They didn't see it as a spike that we had. We had a spike. Many local authorities had a spike at the beginning of COVID. Telford and Reading didn't, but they are seeing an increase now, and their trajectory, early indications are it's quite similar to us in terms of the increase in under fives. And we obviously do talk to them, you know, quite a lot, but it's too early to kind of actually make that correlation. The other thing is obviously is the data that you've got there, which is absolutely, it's the most up to date, but it's last year's data. We don't actually know what's happened nationally yet because that's not published until October. So that we'll have to relook and see how much of an outlier. So at the moment, our current figures against last year's figures do look like we are an extreme outlier. We might still be an extreme outlier, but we might not, depending on what the returns are when they're published in October. The other thing that I want to say is what we're trying to do is explain our increase. So many local authorities had lots of unaccompanied asylum seeking children. We've had to take lots in the last 2 years. So we've gone from 8 to 37. That's a significant percentage of that 200 increase, if you think about that. So that's one cohort. The other cohort is the 0 to 5. So we've seen a real increase in 0 to 5s. That's the non-accidental injuries, which is right to you. The fact that that's coming in, that those children are coming in at significant harm. So children are coming in via, or not going via the child protection process. They're going in because they've been hurt, and therefore we have no alternative but to issue care proceedings. There's no one answer as to why our looked after children have come up. It's a complicated picture. So one of those aspects is 0 to 5 and injuries and extreme neglect, and that lack of kind of eyes on the child at an early opportunity. Second is unaccompanied asylum seeking children. Third is the number of children that come in with such harm that we've had to issue care proceedings. Quite often that is underpinned by parental mental health, domestic abuse, drug and alcohol use, and those lack of services that were available during the pandemic to those adults when they went online. So you have no choice but to go into the court arena when you've got that kind of complexity of need. And I think the other aspect then has been, you know, exiting. So Siobhan's giving you the details about children exiting care. That relies quite often on the court, that during the first 2 years there was quite a significant backlog. The courts were having to prioritise applications. They weren't necessarily doing endings. So that is now moving as well. And we work very closely through the local Family Justice Board to address those delays in the court proceedings, so that the courts are now catching up on some of the special guardianship orders being made, adoption orders being made, etc. So there's no one reason why we've got more children being looked after. One that worries us is the cohorts of families that aren't having that opportunity of services prior to them coming to us, and that's where our area of focus has got to be, in understanding that and addressing that, because you will always have children who are harmed. You will always have, you know, those incidences, sadly. But what we need to address are the ones that are coming in because the opportunities for help earlier have been missed. Does that help a bit?
Yeah, but specifically why that's worse in Shropshire. So I recall actually the conversation that the backlog of the court cases was quite specific. Ours was a worse backlog than elsewhere, and some of the other things you mentioned are specific to Shropshire, so the unaccompanied asylum seekers, but they're not having eyes on children because schools were closed. That's national. So services being closed down.
So I said about school being closed, I said about health
it's not
visitors.
being on children.
So health visitors, school nurses, midwifery.
Is that specific to Shropshire, you're saying?
To a lot of the rural counties, because those staff were redeployed into.
We're comparing
NHS.
against statistical neighbours, so this is as compared to those rural partners. So the question is, what is it that's extra bad in Shropshire? What is it that's missing here?
But even in, it's just different, isn't it? Not every local authority redeployed the staff. And, you know, they have those
to get to the
opportunities.
bottom of it, because we are the local authority and we are responsible for that. So we need to understand what did Shropshire do differently that we mustn't do again, that we must address, because lots of rural counties had the same problem with us, and we need to play our part in making sure it doesn't keep happening. Sorry, I wasn't directed at you.
No, there you go.
So you absolutely right for that challenge in, and one that we put the challenge into the Shropshire Safeguarding Partnership Board. Because when the national letter went out to all NHS partners around the country to say that, you know, the priority is to vaccinate, some systems challenged that and said we need to still have midwives and health visitors protected and doing the priority of doing face-to-face contact with children and families. Here in Shropshire, that didn't happen. The letter was accepted, and the majority of those key frontline workers, they did go out, and their priority was to do the vaccination. I think it's fair to say, committee, that we've learned from that, and that challenge has gone back in. That, you know, God forbid another pandemic comes on our hands, something similar, whereby we are dictated to by a national letter, that actually we put challenge to that into the local system, to ensure that the priority is the absolute face-to-face contact to our children and young people.
I really appreciate the honesty here and getting to the nub of it. We need these things to also be captured in the reports, don't we? We need to be able to drill down and really be clear about which things we can change and which things we can't, so that we've got more of agency going forward in responding. So thank you, I really appreciate that.
Yeah. And I think this is, you know, it's such a huge, great topic, and it's very frustrating because you can't, you know, readily identify a particular area or cause. So the two bits that I picked out of here, it's in 5.4 of the report. You know, and it's been talked about today. The last 50 children that came into care, 80% of them weren't identified by the partner organisations. That is something that we need to sort out. We also need to do target the early help, which, you know, Francine is doing. But I think in order to make any sort of progress and try and unpick this to find out what actually is going on, we need some performance indicators. And what we need to do, this is going to take a while to do, but I'm determined that we're going to make some progress. But I think we're just going to have to do it a brick at a time. So I think we're going to have to come up with some performance indicators. And if we came up with 4, at least we have hopefully some very good information on 4 particular areas, and eventually we will be able to work out exactly where, you know, where this issue is. But it is definitely, I think a lot of it can be tracked back to health, and I think it's incumbent upon us that we help those children, you know, that early help. If we can help the children before they need all sorts of state interventions, that's got to be the best possible outcome for them. And if we're missing 80% of those kids, then that's not good. We need to make sure that we do the best for those kids, pick it up early, and their life outcomes are going to be brilliant. Well, a lot better. Fran's got a hand up, and I've got loads of hands up.
Well, and I think we're going to test. We are going to test the hypothesis around whether children are not known to anybody. I mean, it might be that they're not on our systems, and therefore we think that they're not known to anybody. But in Shropshire, as a council, we've got the wherewithal now, through pooling lots of different data sets into one place, to predict and really get under the skin of which children are actually, in reality, known or not known. Yep, so we're going to use this predictive analytics to look through the last 50 looked after children that Sonia has mentioned and see whether they weren't known to anybody in reality. And if they were known, who were they known to and what did they do about it? So again, if people need support in our early help system, we will provide that support. And actually what families need in the early help system is a lead professional that sticks to that family like glue. Yeah, so we need more lead professionals in our early help system to take on that responsibility. Yeah, and it's that shared collective responsibility that we need to get back to. We've lost it. We've lost some of it and we need to reset it and re-engage our partners, which is all part of our plan.
And what Fran means by lead professional, it could be a health visitor, it could be a teacher, it could be a youth worker. In terms of that lead professional, it doesn't mean that it all comes into targeted early help local authority. That lead professional could be anybody within the system.
Okay, Sonia.
Okay, I think there is also another acceptance that we need to be making here in Shropshire, and that is life has changed for a lot of our families, and particularly those that don't have strong family networks of support. And recently at the Brighter Futures event, I gave an example of how many children we're having adopted here in Shropshire. The threshold for a child to be adopted is that that child has to be either have been very seriously harmed or be at very, very serious risk of being very seriously harmed. It is extremely difficult to remove a small child from the family and to get to a point whereby they are being adopted. If I remember rightly, and this is off the top of my head, in the year before the pandemic, we had 6 children adopted in Shropshire. Last year we had 12. This year we're on a trajectory to 32. The level of harm that is being experienced by our children is significant, and I think that is because life is changing, and I think that has to be a level of acceptance that family life is different and it's stressful and it's difficult and people are struggling, and financial impact, poverty, the ability to cope, resilience, the impact of COVID, these accumulated factors are impacting on children's lives. So I'm not clear that every child coming into care shouldn't be here in Shropshire, because otherwise we wouldn't be having children adopted. It's one outcome and it's for a particular cohort, but that shift in that cohort shows and is a very clear demonstration of the significant complexity and shift in what is actually the real lived experience for our families. And we get that in children's social care because we see it every day. But I think there is an element of understanding that that is what is happening. And those children aren't off one estate, they're not from one village, they're not from one aspect, they are from across the county. And it is an indicator of how significant and severe their lived experiences of their families have been for the last few years.
Okay, thank you. So I've got 2 people who've got their hand up, Joyce and then Ruth.
Thank you.
I'm Roger. So.
Given the extreme pressures and stresses that families are under at the moment with the cost of living rise, are you anticipating a large increase in the number of looked after children as a result of that? Because obviously when people get stressed at home, they tend to take it out on the family. Are we preparing for us? Have we got anything in place for those extra numbers should they come through?
Poverty on its own is not a reason to bring a child into care, and I just want to be really kind of clear about that. But that is in terms of poverty and the financial implications, and if that's the major stress factor, then that would be picked up in terms of the assessment, and we would support those families to cope and manage. And there are supports available, and there is support there, that the social workers can access in terms of enabling that aspect to be addressed. I think it's a trigger factor, isn't it, in terms of lots of other things happening. When you get lots of other things happening, then you get that cumulative impact on particularly on a child. I don't know whether we're going to see that, whether we've already seen our increase here, and that's what we're dealing with, or whether it's going to continue. I'm hopeful it won't continue. Poverty in itself means that, just on its own means we won't bring those children into care just for that kind of factor. However, we will try and work with families to help move that forward. But where it is a significant factor and we can't rectify it and parents aren't coping and there are other aspects, then we may well see that. I think it's too early to tell is the answer to that question.
Okay, thank you so much.
That's okay.
Thank you.
Okay, Ruth.
Thank you. It is concerning the number of people, number of young people in care, but obviously they're there for the right reason. So it's not concerning in that way. If you see what I mean, it is financially they're not under care. And I just wonder if we, picking up Fran's point around, are these children really not known to anyone? I'm just wondering whether we should be looking at from the other angle and whether we're allowed to data protection and everything. But if we know we have parents with mental health or drug and alcohol problems, is there any tracking and correlation of those people we support through to the child and the family? Is that possible, Fran?
Yes, so I'll bring in Fran again, but we're working on projects, aren't we, Fran, called Predictive Analytics, which Fran is leading on, which just answers that question, Ruth. But just in a very quick sentence, Fran, do you want to just describe that work and how we're going to roll that out so that we can start to predict the families that might require some additional support from us?
Yeah, so in really simple terms, all of the data that we've gathered tells us that entire picture down to an individual child or group of siblings in one individual household. So if we cross-reference all of that information around drugs, alcohol, debt, about to be evicted, have applied as a homeless person in the past, are known to the police, all of this information, we've pulled it all into one place and we've got a list of families information where we work as a collective. So we work as an integrated team of professionals, lead professionals, once we've got that data, to understand who is the best lead professional to work with the family. And that can be from any sector. But the point is that we are able to identify families really early on. We've got a level of detail around that family that we've never had, and we can triangulate that with our partners. And then we can choose who's the best lead professional to get that multi-agency response up and running and coordinated and reviewed so that we understand when we're making progress with families. We have got that wherewithal now. Now, the tricky thing, of course, with all of this, in terms of the ethics of predictive analytics, is, of course, the family may not know we've got the information. So what we've got to work out is who is the best lead professional, how do we gain consent from the family, and how do we then get our toe in the door? So we've got a pilot running in two parts of Shropshire at the moment. One is with a group of schools and one is with a group of lead professionals from all sectors within the Northwest, which is in Oswestry. And we're going to start piloting this information and this type of data with those pilot sites, and we need to track to see what difference it makes to the family, but also how early have we managed to get in. What have we headed off as a result of all this information? So this is one tool that we've got in our toolbox. It's not the be all and end all, because of course you need to get the right person in the door to work with, to continually work with the family so that they can access lower levels of early help and universal provision. You know, and they don't keep coming back through our services. They're able to stand on their own 2 feet. You know, they're resilient. They've got all the support networks in their own community and they can crack on. So that's the idea. We are working with other local authorities. So East Sussex has piloted this way of working for the past 3 years. We're working very closely with them to understand what lessons they learned from it, how they adapted, how they flexed, how they improved the work that they were undertaking. But we're starting from a pretty good point in time because we can actually pool all this data as we speak.
Ruth, just wanted to ask one
very quickly, and thank you, actually, that's helpful. I suppose if you can overcome the ethics, then potentially that's a performance indicator, isn't it, that you're alluding to.
Yeah.
Chair. That's one of those performance indicators that gives you a sort of
strategic overview.
Yeah.
Well, and you will have early help indicators as part of the, the delivery plan. So as part of the Shropshire plan, and the early help delivery plan sits under that, you will have early help indicators. And one of those is how many families have we helped earlier? What were the outcomes for the children in that? What impacts have we had? And some of that we can prove, but we think with the predictive analytics that we can go that one step further in really getting to the nub of whether families are known to professionals or not. And if they're not known, who is the right professional to get stuck in?
So we could debate all day about performance data. I get what you're saying about your particular performance data. What I'm trying to achieve, or working towards anyway, is trying to actually get the performance data that will actually help us to help people and track the journey. Because I think until we actually get that start to finish data and identify, where the system is getting blocked up and how we're actually helping people, we're not going to get anywhere. Because we can get all this other performance data, but actually if we can turn around and say, if you have a child with mental health issues that comes to you and is seen by you within 45 days, we don't want it to take 3 years for that family to get any help. That's exactly, I know I've had people come to me with that. It's a horrendous situation for these families who've got kids with mental health issues. 3 years, and my heart bleeds for the families and for the children, because their life outcomes, having suffered for so long, are going to be so much less. So to me, to try and get some of that early help and actually get the help to those people sooner rather than later is just so important. So anyway, there we go. But who's next? Roger.
Thank you, Chair. Not sure if we're coming to this later or well, and that's stepping stones. Are we talking about that shortly, or?
Yeah, we are.
About that, because I note that it's there, and it was 2019 when the council agreed to set it up, but it was 2021 before it started. I'm not sure why the delays there. And also, whilst I'm here, is concerned about a couple of items in the Ofsted report, but stepping stones. Are we doing it? Yes, we are. Are we putting sufficient resources into it? I don't know. And what's the future? Because that is a way of identifying early help. Because that's many scrutinies. Peggy's chaired them, where we've been told with respect to the present director, is that Shropshire Council was targeting early help because that was where it was most effective, and it would stop the cost to Shropshire later on, but also make it better for the child the sooner that help can be provided. So stepping stones is along that project, as I understand it, and there's financial savings that are being shown in it, but there seems to be an 18 months, 2 years gap before it was being implemented. But are there sufficient resources being put into it now to take it forward?
Thank you, Councillor Evans. So let me answer that as best I can in an order. The reason that there was a delay was that we, in the same months that the funding was agreed, we entered an international pandemic, and I'm afraid my service focused on surviving that first 12 months. What we weren't able to do was to redeploy people to set up the new project. Those people that were there needed to focus on keeping the service as it was steady and the ship steady for that 12 months. We then set it up in the second year of the pandemic, and as you can see from the report, it was highly successful in its first year, and that is why we want to expand it. So Stepping Stones has a good level of resourcing and has highly skilled staff, trained staff, where there is currently a business case with directors, which we're hoping is going to be agreed in the next week or so, to treble the Stepping Stones resource, so that we can treble the impact that it's having in terms of the early help aspect here is trying to prevent children becoming looked after. It's not early help as in the definition of Fran's area. So it's about trying to target those resources, those families that most need a much more intensive. So it's a very intensive way of working with families. but that we can try and keep those children with those families before they become looked after, or if they do have to become looked after, that we can work with those families to set them back down where it's safe to do so. So it has been highly effective. It has resulted in savings, but that's not its ultimate kind of outcome. And if we get that opportunity to treble it, one of those hubs that we have and the way that it's set up will be targeted at working with families with 0 to 5s. So working a slightly different way with those parents and those children. So I hope that answers your question. If it doesn't, come back to me.
It's just we're a panel here. We can make recommendations and try to help you deliver what everybody wants. So that's where I'm coming from. So is there sufficient resources? Do you want this panel to do anything with the agreement of others to push along? Because the stepping stones, as I understand it, is a complete success story. So we need to do that in order to reap the benefits for the child and the council. So it's a double win-win-win if it can, when it succeeds, not if, when it succeeds.
So my understanding, there aren't any barriers to that, but I'm sure that your support being formally recorded would be supportive.
Thank you. Well, I am very conscious of time now, so who's next in the chair? If you all ready to do you all had a go in the chair?
I think we're connected parents or from real.
I think we've probably covered most of those points with questions and that's really so.
There's someone at the back I haven't seen.
So Jenny's doing workforce, so if you just do care leavers.
Care leavers, right,
So
okay.
do you want care leavers in terms of the need to eat?
Yeah. Thanks, Daniel.
So we track all children who've reached statutory school leaving age to check whether they're in education, employment or training, and those who are not in education, employment or training, and we are in line with the national average, which isn't a great national average. We are in line with it. We benefited, our care leavers benefited hugely from the National Kickstart scheme, and that did affect our figures beneficially really last year, and going into early this year they have started to decline again this year as the Kickstart scheme has come to an end, and there are a lot of other schemes that have come in, and our council's got our council has the ladder for Shropshire, and care leavers have a preferential sort of like we can go to straight to interview with a DB that meets the criteria. And we also sort of are involved with the way to work and the job fairs and care to learn as well. So we are involved in a lot of the initiatives, and we do sort of like try to sort of hold our own in terms of finding our care leavers jobs or employment and education. For those young people who are in education, employment and training, we do have sort of high aspirations for them. So last year we had 3 who had really good degrees. I mean, sort of one lad got a first, and they're not having their ceremonies till this year, but they're sort of, and then we've got another 3 who are likely to get their degrees this year, although some of them don't actually finish till January, so we won't know their outcome until then. We've got 20 who are in other forms of education, and many in training or employment. For those who are not in education and employment, we do have a number who are not there because of illness or disability. So some of those will have very complex needs. Some of them might actually be so poorly that they might be in hospital, or they might be sort of have multiple disabilities and complex needs. Some of them it's related more to mental health issues and trauma. We have 4 young people who are pregnant, so not all of our young people who are pregnant aren't in work. It's usually as they're, as most people, as you're approaching sort of your, sort of your delivery, you're sort of maybe not able to. And then we have the contingent that we most sort of focus on are those young people who really struggle with engaging with the wider society. Really, they're often people who are either very anxious, For some young people, the first step with their job coach and their personal advising might be just going for a coffee, actually leaving their home and meeting other people. Some young people need help all for every step along the way, in terms of helping them with their application, going along with them to interviews and supporting them with things like what they wear, how they talk, giving them sort of like, you know, sort of like model interview type things. Some of our young people are, we've got a couple of young people who are in prison, so they're not accessing, you know, education, employment and training. I think in terms of how we can improve that, we have got proposals, you know, sort of to be looking at whether we can focus more with our life skills partners and with the DWP to see whether there are particular young people that we could assist more in terms of their CV, in terms of gaining their functional skills that enable them to meet the criteria for a lot of the jobs. The council does have some apprenticeships that are focused for care leavers, and we particularly have a care leaver champion sort of apprenticeship. Our last apprentice has just finished there. She's finished her apprenticeship and she's got a full-time job with the council, and we're looking to recruit our next one. So we do have a lot of initiatives. We'd like to reduce our number of young people not in education, employment and training, but like I say, it is a national issue. I mean, nationally, for the age group of all children in the country, there's usually between 10 and 15% who are not in education, employment and training. For care leavers nationally, that rises to between 40 and 45%. And we're at the lower end of that. So we're usually bumping along around sort of 38, between 38 and 40 something percent of not in education, employment and training. So we'd like to do a lot more, but I think for care leavers generally, the national picture isn't pretty in comparison to most children.
Okay, thank you very much indeed. Sonia, do you want to have a last say or?
No, I've just got.
No.
Not right. There were some workforce questions, and Jenny is here, and we have got one slide on workforce, and there were some of those questions.
Right.
So I think it would be good just to swap Jenny in.
Right. Can we have Jenny in then, Roger?
So just while Jenny settles, Jenny Lowe is our principal social worker at the moment, and she covers the workforce and learning development side of the principal social worker role, whereas Siobhan has the lead for sort of safeguarding and quality assurance. So it's a split role at the moment. So if you put the slide up for workforce and development, please.
Yeah, so this is our workforce profile as of this month, which outlines how many workers we have. I think given the questions that have been asked today, it's best to kind of focus on the agency rates there, which is at 30%, and our vacancy rate, which is at 20%. I think it's important to put that in context, really. I mean, Sonia's already covered some of the why in terms of social workers leaving the profession, and did so very well in the short space of time, because they are many and varied reasons why people are leaving. Obviously, our local context is that we've got a 20% vacancy rate. The national picture statistics, won't be updated until September this year, but last year's data showed that nearly 5,000, it was 4,995 social workers left the profession, which was up 16% from the previous year, and it's the highest it's been for 5 years. There's a national vacancy rate of 6,522 across the UK. That's up by 7%, and again, it's the highest number for 5 years. So we're very much, I think we are not showing quite the vacancy rate that other local authorities are, but where we're struggling fits into the national picture. In terms of recruitment, we had put significant investment into a campaign trying to attract social workers from London and the South East. We are awaiting the final analytics around that advertising campaign, but the main headline is that it just simply wasn't successful. We garnered one application and one appointment from that application, but overall that was extremely disappointing. We're having to look at the reasons for this, and we do feel that our package in terms of pay and benefits is quite competitive, and it's not falling behind other local authorities. But as Sonia mentioned, the pressure in the West Midlands is very much focused around Solihull and Herefordshire, and therefore we're struggling to recruit permanent and agency social workers. And there are a number of social workers nationally who have always been permanent who are now going agency and moving into those roles that are short-term and very highly paid. We've noted when trying to recruit social workers that even our specialist teams and really specialist roles that have been set up, which usually would attract quite a lot of applicants or certainly a lot of attention and people making inquiries and applications, hasn't gained that kind of traction at all. So it's a really challenging picture. What we're doing now is advertising more locally. I mean, we have been doing that anyway, but we were keen to try and look a bit further afield and attract people into Shropshire. But we're advertising locally in WM jobs, and we're also looking at having an advertising campaign using the resources that we bought in our main advertising campaign and putting that into community care. We have a focus on trying to recruit or convert our agency staff into permanent. As Sonia mentioned, there's 6 agency workers who have said they'd like to come permanently with us. There's another possible 3. 9 people might not sound like a lot in the grand scheme of things, but that equates to about £30,000 per worker in terms of savings. So that is actually a significant step forward, and it's a really big decision for an agency worker to go permanent, particularly in the current kind of national climate. As Sonia said, we do have a retention package, and what we're trying to do now is really focus, and obviously my role and why I'm here is to focus on our learning and development package in respect of retaining people and developing our staff, particularly in the context of the care review. We know that our newly qualified social workers who go through their first year of practice, which is assessed and supported in a very formal way, they have a very good experience generally in their first year. Then they go into practice, that support naturally drops off, and they're much more into frontline social work, and it can be a bit of a shock. And we are losing, in Shropshire, but also nationally, we're seeing newly qualified workers not staying in the profession for very long. So what we're looking at doing is putting together a 3-year programme, 1 year for that newly qualified. It's called the ASYE year, so the assessed year, assessment supported year in employment, and then plus 2 years of a much more focused package of continual professional development, which will provide that support to social workers and also have quite structured training, learning and development, so that we can make sure that our staff feel invested in, and that also we're building a workforce that can last. I spoke very quickly then because I'm mindful of time, but I don't know if anybody's got any questions off that.
Roger had a question, and there's
The reason why I mentioned it earlier is obviously because it is a national problem.
Yeah.
But that package that you're suggesting, if we can retain in a more professional way with a package, is the best way forward, surely. And I think that sounds more positive step to move on. Yeah, thank you.
Roger, did you want to ask your question? Or?
Yeah, good slide that is.
Yeah.
I presume all the slides will be circulated to us shortly, because I think it is useful. And I think it would be good to circulate it to all the council members, all the councillors, because that one especially shows where we are. A social worker is not a job that I could do. I congratulate all those who actually do it. But what I wanted to ask was the police, and I noticed, and it's in the Ofsted report, about they withdrew support, I suppose, is my way of putting it, but then they came back and it was sorted during the Ofsted report that was there. So hopefully that will continue. But I see also in the Ofsted report, there's a recent dip in RHIs taking place following incidents of children going missing. Now, in the light of especially the report that was yesterday, those children who are missing, they are at risk, and I would hope that we are doing something about it. But is there anything that could be added to that in the light of the findings yesterday? Because I think some of it happened many, many years ago under the old county council, but more recently, Telford had the problems, but we may well have had children who absconded, went over to join them or whatever. But is there anything that we need to help with or anything like that at all? And then I've got one more point, Chairman.
Thank you, Councillor Evans. So in terms of responding to yesterday's report, we'll be reviewing all 57 of the recommendations that are in that report, and we'll be doing a self-assessment against those to see which ones we need to think about. Do we need to do anything differently, etc. We only saw the report at 5:30 last night as well. So, and obviously one of those areas is particularly around what we do to respond to missing. So what I can do is give you assurance that we respond to children who go missing and we see them where they let us, where we do face challenges within the performance of getting those written up, and that is an area that we need to continue to work on. But we will be doing a sort of self-evaluation, if you like, against all of those recommendations and working out what's relevant and where we do need to grow and develop. So that may be something that this People's Scrutiny overview may want to see in the near future.
If I can, Chair, I was going to suggest that maybe that needs to go to community scrutiny forum.
It's getting longer, Roger.
I know. I can add to it if you want.
Yeah.
But yeah, and because I think it is important that we do take action and members can see exactly what is happening because it's in partnership between ourselves. And then I see in the Ofsted also there's an action plan. Now, is this the action plan or not? Or is there an action plan that I've missed that's there with dates, because it says about May 22 being implemented, things like that. So I just wondered where we were with that.
Didn't we do this at the last? We did this at People's Scrutiny in the
Okay,
meeting.
However, I do note that I did promise to circulate to members of People's Scrutiny that plan. It was only submitted to Ofsted last Friday. So it is there. We updated it, submitted to Ofsted last Friday, and we'll get it circulated to members.
Okay, Robert.
Mine was only to come back to the question I asked originally around the assessment teams and what level of vacancies were there. In my brain's it's too far gone to try and work out the sums. Is it just a flat 20%?
No, it's two. It's two.
That was the idea. I was trying to get, is it, are we talking a couple of people or is it a big thing and so on? So as my other one was, I just saw the average caseload. I'm just wondering how that compares or what we normally want the caseload to sit at.
I'd say it's a bit on the high side myself.
I'm going to disappoint you here slightly because that's a very misleading average. So that's the way that it's managed nationally, and we are higher than the national average. So the national average is 16.4. However, if you were to talk to our social workers on the ground today, we have social workers, particularly in the front door, with cases of 30 plus. We know about that, we understand about that, there's action in progress. The vast majority of our workers at the moment are probably operating between 22 and 26. We really need to aspire between 15 and 18. It is a real challenge for our social workers on a day-to-day basis. I met with a group this morning with a principal social worker, and caseload is a big challenge for them. The problem is that the way it's calculated means that the average is brought down. So, you know, we monitor caseloads on a weekly basis. The service managers keep a very close eye on it. They proactively manage them, but it is a real area of challenge for us. Personally, I think that's a different area that people's, committee can look at and understand in more detail, because it varies so much depending on which role you're in as to what your caseload is. But it's a very good way of making it look better by averaging it out right the way across. It's just not, you're comparing apples, pears and strawberries really, and then averaging it. So, it's a challenge.
Roger, very, very quickly now.
It is a quick one, Chairman, and it's about the police and the cooperation and working with them. I, with some other councillors, sit on the crime and policing panel, and I think we negligent if we didn't bring that up there to bring it to the attention that we are having difficulty and not receiving the cooperation that we should be given. So it's just reassurance that cooperation is there and it is continuing.
I would say that we had very good working relationship with the police. I think that was an unfortunate timing that a particular area that they were looking at and trying to make equitable across West Mercia, because obviously they have a wide footprint, directly impacted on our front door. We have a very positive working relationship with the police at all levels, particularly in relation to exploitation, front door strategy discussions. We're co-located with our police colleagues at Mount McKinley, and the leadership relationship is very positive as well. To compare to our police colleagues, they resolved that issue quickly and, you know, got the solution in place. And they do respond when we have challenges and issues, as we do to them when they raise issues and challenges with us as well. At this point in time, it changes. We don't have particular challenges or working relationship issues with the police.
It didn't come out the report very well, but anyway, that's another day. Julia, very briefly, because I think we have to wrap this up.
I'm really pleased to hear about the work around retention as a package as you put it together. I hope that we could also be a bit more proactive around recruitment. Please let's look at using underspent from vacancies, have a golden handshake, or welcome to Shropshire, a bonus, you know, market forces. Never mind what the national picture is, let's be proactive. We've got a budget surplus sitting there with staffing written on it, and we've got all these vacancies.
Councillor Buckley, can I assure you that is not an unspent budget?
Okay.
No, I just need, yeah, we don't carry vacancies, we can't.
20 right there.
Yeah, no, that's their vacant post, but they're covered by 30% agency.
So we need
30% additional cost.
So we need to shift those across, don't we, by recruiting, making it more attractive to recruit people here. And what I wanted to check, and I'm sure you're already doing it, is to ensure that you're working with the unions, and in particular Unison. As I understand it, social work is one of the highest unionised sectors of work because it brings with it that insurance. They've got lots of data from members about what they want. So when you're putting together packages to attract people and retain them, they've got access to thousands of members who want to work in this field, and they can describe to you whether it's money they want or hours or part-time or whatever. Work with them. They will be so pleased to support you, advise you, give you some suggestions. And actually, they've got access to those members who are often looking for different roles. So I would really encourage you to consider that as a resource at your fingertips. And they would be delighted if you did, if you're not already making contact.
Okay, thank you. Well, thank you so.
Before you go,
Oh yeah. Sorry, thank you.
you've talked about the performance indicators, when that is likely to be coming forward.
Well, they're not unless we do something about it, because the performance indicators we need are the performance indicators that we need to work with the ICS. Yeah, so we can't get performance indicators without working with the wider system, which is where I'm going to come to in the recommendations.
Oh, that's
Okay.
Yeah.
So thank you all very much indeed. I hope you found it interesting, entertaining, whatever. And all I'd say to all of you is we're here to do a job and to help everybody, including yourselves. So if you've got any ideas on what we can do to improve things, or you ever want to talk to any of us, then please give us a call and I'll be happy to talk to you about anything at all. So thank you very much indeed, and all the very best. Keep up the good work. So we come to the recommendations. So hopefully we're not going to argue too long about this. So at the people scrutiny meeting we had the other week, they agreed that we could look at a joint scrutiny with people to look at the key target performance areas. Okay, these target areas should cover how the emotional and mental health needs of the looked after children are met from first contact to discharge. And to look at the best way to work with the ICS and produce audited outcomes and key performance areas. That's what I've suggested. So I think it's really, I think in essence, it's another scrutiny committee as a catch-all to make sure we get all the key things in there. Because I think ultimately we need to work out which key areas we're going to challenge the ICS on. And we need to challenge them on things that hopefully will help our children the most. And we haven't figured that out yet. That's what I'd say. But open to offers. Is everyone content? Julia?
Yeah, I appreciate the suggestion, and I think that's one part of the equation, but we did say earlier on that we mustn't jump to the conclusion that that's the only problem here. So I think before we agree on the what, we really need to understand the why. So we need to have bottomed out and be assured what the causal link is as to why Shropshire is an outlier. So some things I heard today, because in 7.2 it asks us, do we need further information or actions? So I think we need further information before we agree on the actions. One thing which I'm hearing is a very hopeful thing in the future is that our current data is being compared with neighbours in the regions from last year. So ours is up to date, but we're not being compared with everybody else's up to date, and that we can't get that, I think, until the autumn. When that comes, we might not be an outlier. So that's the very first thing, that we need to be compared with up-to-date statistics, and it needs to be disaggregated. So we're not looking at every part of this picture, but we're teasing out the specific areas where there is an anomaly and a problem. And then I'm not sure that just choosing one partner and one aspect of one partner is the only problem here. I agree, it's probably a significant problem.
Which one partner? What one
You're
partner?
picking out the mental health service provision and using the ICS to hold them to account, which is excellent. But we've got no guarantee that that's the only issue here.
I agree with you,
Yeah.
but if we don't make some progress, then all we're going to do is we're going to wait for more performance data later on in the year, which won't give us the issues really. It'll just be another bunch of performance data. What I want to try and do is meet up with the guy from the ICS. He offered to meet with me to discuss these performance indicators. And what I want to do is try and improve the outcome for these kids who've got, you know, the mental health issues that need the help now. I want to try and help them and make the whole system for that particular thing more transparent. I think it's an ongoing thing, so we can work on one thing and still have another coming down the line.
Absolutely, there's more than one issue.
More than one. I mean, you know, and I think the thing is, it is so big. This whole thing is so big that if we need to go for the 3 or 4 big ones, and I don't know what all 4 of those big ones are yet.
Do we need to do some more
But we
finding
need
out?
to do some more finding out. Absolutely agree with you on that, Julia, and I'm quite happy to work with anybody to try and do that. But what I'm anxious about is, because the offer's been made from the ICS to actually meet with me about performance targets, is that we actually meet up and actually achieve a couple of performance targets. Because if we can help even a few of these young kids, then it'll be worthwhile. But what I don't want them to do is, we rejected the CCG's report. I don't want them to sit back on their heels and say, okay, she's gone away now, we can just go back to normal. You know, I want to keep the pressure on, and I want to improve the service. And I want to help these kids and their families. So
that's important, but it overlaps with this report in one area. So today we're talking about this report, and you're describing holding the ICS to account from a different report, but there is of course an overlap, and I think that's really important.
Yeah,
and let's not lose sight of the other things in this report.
No, we won't.
Need looking at.
Yeah,
I would like to ask some questions about early warnings. So we've heard about partners reporting or not checking. We've heard about when we know there's an issue, early help and response. My concern is back to those holes. When something doesn't happen, why doesn't it flash up a light somewhere so that the hole flashes, so that early help would know if it was a problem, and after there's a problem we look back and find a hole, but the hole doesn't flash up as an early warning. That's the thing I want to find out more about.
But I think, and this is a chicken and egg thing, isn't it? I think we've set up the performance indicator, and the performance indicator isn't working how we expected, because we will be checking it. Then the performance indicator will throw up the holes. The important thing is we're working on it, and as we're working on it, we will discover those holes.
Surely, Chairman, as well, if you're going on with your suggestion, you can add to that.
Yeah, we can, absolutely. It's not, you know, all I'm trying to do is to do something. We can absolutely add more to it as we go along. But I just feel we've got the momentum with us. We have to start somewhere. So I'm quite happy to add other stuff.
And Chair, if I can suggest, and team, please don't kill me later. But I think it would be important for this committee to have a further report in about 6 months' time. Because what you've heard today is about us resetting the early help offer in terms of that universal support, the eyes on the under 5s, the targeted early help, the further work, the stepping stones that we've talked about, and our revised approach in terms of the public law outline. These are all kind of work that we're working on, and I would hope to see 6 months time, further reports of this committee which will evidence some of the impacts of those 3 key areas.
Thank you. Chair, that's really well. Could we ask that some of those specific areas of concern we've raised could be a focus in there, like the disabled children's team, like the staffing issues, so that actually what we're getting and the early warnings, so that yes, we absolutely need, to me, it's the extra information now which boils down to the problems. But I think we've pretty much talked around the same key things that have popped up, and if they could be focused on as well, that'd be excellent.
Yep, I don't have a problem with that. So we're all happy. So have I got a second there?
I'll second.
Oh, Roger's seconding. Okay. So all those in favour of the recommendations? Yep, unanimous. And I'm really pleased about that. Okay. Thank you very much indeed. Oh, we've got to carry on. We haven't finished yet. Sorry. The work programme, I suggest we'll leave that, because poor Daniel, he's got COVID and he's struggling. Usually has a sleep in the afternoon, so we'll leave that and we'll let him get better and do that.
You mean you're considering the stuff?
Yeah. So we've got to exclude the press and the public, because we've got to just agree this extended minute on the 27th of January, and Roger wants it altering. So if we could finish the live stream, is that all right?